Gentlemen, welcome to the second international conference, Healthcare Metaverse. This is our second conference leading up from last year's conference in Manchester. It is an honor for me to introduce and MC this conference and do the proceedings. There will be 3 sessions in this conference today. The first session will be from hospitals and medical societies from all over the world in relation to Metaverse applications. The second session will be from global leading XR and Metaverse technology leading companies. They will share their research development and their future plans. The final session will provide an opportunity for companies based on XR and Metaverse applications to introduce their products. Even if you're busy, people who are interested in the Metaverse space, I'm sure you'll find time to sit through this wonderful conference till the end. To kick off the conference, I have with me today from the Manchester Foundation Trust, Dr. Ralph MacKinnon, to deliver the inaugural address. Ralph, please.
Thank you, Professor Ahmed. It is a great honor and pleasure to welcome you to this International Healthcare Metaverse Conference. My name is Professor Ralph MacKinnon. I am a consultant at Royal Manchester Children's Hospital, Manchester Foundation Trust, and the CEO of Health on Cloud UK. If we feel this concept for this conference is so important, and I believe it is, then it's important to understand its history and its direction. It was absolutely conceived in Korea. However, I feel the first breaths were made in Manchester. So now in Manchester we were breathing. Now we need to crawl, walk, and then run. But in what direction do we need to travel? So I feel, and I believe the people here feel, that this will be a direction together as a community, to create a community of practice for healthcare in the metaverse. A community of practice where we are mutually engaged, where we come to meetings like this, where we share our ideas, and where we have spin-off meetings, and we create networks and alliances of hospitals and of universities, medical schools, nursing, and industries together, where we have a joint accountability, where in fact it is our responsibility to create the highest quality of metaverse in healthcare in terms of enhancing both patient safety and patient care. And then finally, it is for us to share and to share our resources as developed countries to developing countries, and where possible, vice versa. But sharing our resources also means that we have the ability to co-create and to create these resources together as a community. I hope that you will enjoy this meeting, and I look forward to the fantastic presentations. Thank you.
Thank you, Ralph. Next, we have Dr. Chung, the ex-Minister of Health and Welfare of the Republic of Korea. Dr. Chung, please.
Good morning, everyone. Let me start by saying that it is my great honor and privilege to be here with you all today for this wonderful initiative. My name is Chung. I'm a former president of Seoul National University Bunda Hospital and also the former minister of the Ministry of Health and Welfare for the Republic of Korea. In my time in office, I was fortunate to witness a lot of changes and a lot of attempts to change regarding the advancement of healthcare. But as we all know, change is not always so easy, especially when it comes to people's health. Healthcare is a universal need and one of the most regulated industries in the world. These regulations are extremely important, but it can sometimes hinder the innovation and change. Through the years, I have noticed that every hospital has a small niche for innovative people who aim to drive change and innovate their field of expertise. but this can be quite difficult without proper support and encouragement of their peers. When I look at today's event and what it stands for, I can see a light at the end of the tunnel for those dreaming of change. There is a power in numbers, and we will take those numbers to drive the new digital frontier. When I first heard about the Smart Hospital Alliance, it reminds me of all those determined individuals who never got the chance to bring their dreams to reality. However, I believe that they have a chance to move forward through this alliance and the global cooperation. I wish you all success in what you are trying to achieve, and I believe that it will take cooperation to make it all happen. So please take advantage of this event and learn to work together to make your dreams come true. Thank you.
Thank you, Dr. Chung. Finally, to welcome the 2022 International Healthcare Metaverse Conference, we will watch a congratulatory video message sent by the Governor, Cheol of the North Gyeongsang Province at the conference.
안녕하십니까. 이철우 경상북도 도지사입니다. 세계적인 전문가들이 참여하는 컨퍼런스에서 여러분께 인사드릴 수 있어서 매우 영광입니다. 저는 메타버스 수도 경상북도라는 슬로건으로 우리 삶의 모든 분야에 대한 디지털 전환 프로젝트를 펼치고 있습니다. 그 중에서도 의료와 헬스케어에 큰 관심을 가지고 있습니다. 경북은 대한민국 면적의 약 20%를 차지할 만큼 면적이 크고 고령화율도 높은데 적은 인구와 지리적 접근성 문제 등으로 의료 서비스의 공급이 상당히 부족한 상황입니다. 의료나 헬스케어가 확장 현실 기술과 성공적으로 영업될 수 있다면 더 많은 도민들이 더 훌륭한 의료 서비스를 받을 수 있을 것으로 기대하고 있습니다. 경상북도는 대한민국에서 유일하게 XR 디바이스 지원센터를 가지고 있고 제조업이 발달해 있기 때문에 의료 및 헬스케어와 관련한 혁신적인 디바이스를 개발하고 생산할 수 있는 능력도 가지고 있습니다. 언젠가 우리 경상북도를 찾아주기를 바라며 오늘 컨퍼런스에서 나누는 여러 아이디어들이 세계 곳곳의 의료 현장을 혁신하는 훌륭한 결과로 이어지기를 기대하고 응원합니다. 여러분, 화이팅!
Although he was not with us, we will start the 2022 International Health Metaverse Conference by expressing our gratitude to Governor Cheol. The first person to present in this session will be Dr. Wonjae, Department of Cardiovascular Medicine at the Seoul National University Hospital, Bundang. Professor Lee Wonjae graduated from the Seoul National University Medical School and completed his medical training course and fellowship course at the University Hospital, currently working as a professor at the International Medical Center at the Bundang Seoul National University Hospital. And he's in charge of external cooperation and also runs the Smart Hospital Alliance from here. Dr. Lee, please.
Thank you, Doctor. My name is Wonjae Lee. I'm an interventional cardiologist, and also I'm Chief Medical Lead for Health Sun Cloud. So it is my honor to present Smart Hospital Alliance initiative in this meaningful event. So let me start with the concept of Smart Hospital. Smart Hospital maximizes clinical excellence, patient safety, and customer satisfaction by utilizing the most recent and up-to-date information and communication technology. And what is Smart Hospital Alliance? It is a network of smart hospitals around the globe to play a leading role in conducting related clinical trials, evaluation, and development of these applications with the aid of cutting-edge technology to determine their usefulness through field testing. So what Smart Hospital Alliance do together, we co-produce VR contents for key medical training and education. And also we co-research and test for the cutting edge digital healthcare product. We also create a global consulting network and medical tourism network for emerging countries around the world. So what Smart Hospital Alliance will benefit from forming this alliance? So we're building and developing extra medical contents with global leading hospital, which will direct cost savings and higher quality. And we are exposed to cutting edge digital healthcare technology so that we can utilize the advanced technology for the first time and host clinical trials come with a great research funds and bigger impact. And by communicating regularly with leaders of global leading hospitals, we can always stay on top, driving global standards. So we believe that there's a vast area of collaboration in this digital healthcare space. And we believe that Smart Hospital Alliance will be a starting point for a joint effort to drive digital inclusion in healthcare and global medical education. So currently, we have a lot of hospitals already signed to join the Hospital Alliance, and also there are many hospitals in progress of discussing to join this our alliance. We hope to have more and more prestigious hospitals joining our alliance to make it better. So let me just share briefly of some of the initiatives we are doing so far within this Smart Hospital Alliance. So we are working on setting up Smart OR for medical education for experts. So SNUBH actually introduced Smart OR in March 2019, and I think a lot of you know about this Smart OR already. And we helped other medical institutions. So National University Hospital in Singapore, they already established Smart OR in their hospital. And also we are working together with MFT, Manchester Founder Trust, and Northern Carolina, and other hospitals and helping them to set up the Smart OR or filming 360 surgery. And we already work with Smart SNPH and as a medical school, a medical center, filming the 3D contents as you see here. And we had a successful ATAP events in Metaverse space last year. And actually tomorrow we are hosting the joint session with ASCBTS and Santa Fe Bogota Foundation while talking about cardiac thoracic surgery. And we're gonna do this in this Metaverse space again. And another project we're doing, so we are working with Asa Medical School to create a 3D sepsis treatment simulation, and also talking with Northern Carolina who are interested in customizing this sepsis content for UK institution as well. And lastly, we are doing clinical trials. We have already started a VR for chemotherapy in hemodialysis patient. We do not have robust results yet because it was a pilot study, but we have some positive results. So we want to expand this within our alliance so we can get the tangible result. Also, for VR, for CPR training in multiple institutions has already done, and there are a lot of many papers has been written. And as you can see, this was co-work from the prestigious institutions around the world. So next step for Smart Hospital Alliance, we hope to do an offline meeting and sitting together so that we can expand what we're doing right now and do more and more collaborative projects together. Thank you.
Thanks, Dr. Lee. The next speaker will be Professor Kofidis from the National University Hospital of Singapore. After graduating from the Ludwig Maximilian University in Germany, completing a fellowship at the Stanford University Medical School, he currently works as the chief of the cardiovascular and thoracic surgery at the National University Hospital in Singapore. Kofidis, please.
Thank you very much, dear chairman, dear Professor John, and organizers of this unique meeting. I would like to share my screen. And go in full presentation mode. So I'm deeply honored to be a part of this conference, and you will be questioning yourselves, what does a cardiac surgeon have to do with it? First of all, a cardiac surgeon who is very involved in education, as is our entire department, must look forward and adopt new techniques in order not to miss this very important train. I do understand from the context of this conference that it's not only about education, but education is a stark domain in what we do here at CTVS in Singapore. And therefore, I would like to share with you, as technology comes in, we are also trying to adopt and amend the ways we are conducting our surgical training. I'm gonna be taking you through a few concepts that we have been implementing here at CTVS in National University Heart Center in Singapore, and that includes a new book concept that involves QR codes and novel audiovisual setups in the operation theater, OT integration and conferences, live transmission, the concept of holography or holographically guided surgical design and strategization, surgical simulation, and then the utilization of 360 camera. Now, these technologies are partially inspired by our interactions with Professor Chung, the ACVTS, which is our professional body, and other inspiring teachers, such as the chairman here, Professor Anis from Singapore as well. And this has been a technical implementations that we have accomplished in less than 12 months. This is a unique book that we have conceived a few years ago, about 3 years ago, because let's face it, nowadays cardiac surgeons don't read the way we used to, the Kirtling Bible, as we used to call it many years ago, decades ago, at the time of my training. Rather, we utilize online technology as well as online material in order to equip ourselves with the appropriate knowledge, surgical knowledge. And if they say an image speaks more than 1,000 words, then I can imagine that a video speaks more than 1,000,000 words. And we don't have a surgical book that employs these technologies. So what we have done is we wrote a book in our area of domain, my personal one, minimal invasive cardiac and endoscopic cardiac surgery, but brought it to life in a way, made it interactive as an educational tool. That means you don't only read the text, how to do it, how not to do it, what to avoid, what instruments to buy, where to learn, but it's embedded with QR codes. So as you read along, you scan with your phone and you can actually see how the operation and the procedure is done. So we have also installed new camera systems in the operation theater, endoscopic cameras, pan-tilt zoom cameras, high definition headlight cameras, 360 degrees cameras, as well as surgical pendant cameras, which combined over certain interface, they can produce amazing content that can be shared with other centers of excellence or any audiences around the world. This is our endoscopic camera. We personally use right now the Olympus system, both 3D as well as 2D. And then we're using an interface where all these, including the OT lights and other appliances, can be unified basically and can be controlled from one single screen. And you can obviously change from one mode of transmission to the other one, from one camera to the other one, up to a maximum of 4 or 5 cameras all at the same time. For example, wall-mounted cameras, we have pan-tilt zoom cameras, which scan the entire operation theater. And this is the way they are connected with the Olympus system and the Olympus control console. Now, when it comes to outside transmissions, we have again a lot of modalities through Zoom, through Wi-Fi, through enhanced Wi-Fi in the operation theater. We have amplifiers of Wi-Fi signals. And then, of course, you can address, as you will appreciate here, the Zoom audience or other types of audiences, live or live in a box. Headlight cameras are evolving as well. We like to use this one here from Sun Optic because it involves the technique of coaxial alignment that allows you for less instability during the transmission of the signal and the movements of the surgeon, as well as great sharpness. 360-degree cameras, as the one you see here, they can be fixed or they can be mobile and go around in the theater, and they allow you for an unprecedented evaluation of what's going on in the theater. You really feel embedded in the operation theater, and you can look everywhere. Secondarily, of course, if you translate that into a VR content, wearing the appropriate goggles, you can basically travel in space and turn your head and look at different directions within the operation theater. It makes it, therefore, a highly interactive and efficient educational training modality. The classical pendant camera on top of our heads is also a very important tool, particularly for open heart surgery, not so much for endoscopic heart surgery. And we have utilized these technologies already for virtual live transmissions from our operation theater in the past. Some of our accomplishments in the last year have been shown in international conferences, such as the International Society of Minimal Invasive Cardiac and Thoracic Surgery Conference recently in Poland. And that brings me to the next one that was presented at the ACVTS as the first venue worldwide. We have done the first holographically guided cardiac surgery in the world, whereby a tool, a Microsoft software is used to translate preoperatively acquired CT images into a hologram, which we can then impose one-to-one over the patient. And while we wear those headsets, we can see both the actual patient without disturbing the actual real-life image, and also project the holography on top of it. The image can be transferred to a laptop and then transmitted to the audience as a dual image. The audience sees what the surgeon sees, basically. Here are some examples. This is preoperative planning on a patient on the table on redo congenital heart surgery, whereas this is a one-to-one overlay to design the exact entry point on the left side of my slide, the exact entry point for minimal invasive and endoscopic aortic surgery. And I'll give you a quick example. Here you see, you define as a surgeon the anatomical guides. In our case, it's the clavicle and the xiphoid. And then you can pinch and take and put the image on top of the patient, exactly one-to-one overlay with anatomical accuracy. The same you can do for minimal invasive bypass surgery procedures, as you will appreciate here. And in both cases, the surgeon can decide exactly where to enter, where to put the camera, his left ventricular vent, his instruments, to maximize the ergonomy and the precision of the entry. The next part in our quest for advanced educational systems is the start of a simulation center. Why do I believe that our simulation center is unique and exemplary is because we're given a large donation. We bought the best digital equipment from around the world, digital and mechanical equipment, and set them up in a simulation center area within our campus. So people who visit us or conduct workshops with us don't have to take the bus and travel outside the city. It's all embedded within the hospital, within the university campus. And that setup features beating heart simulators, coronary artery simulators, aortic and mitral valve torsos from the company Chamberlain in the United States, symbiosis simulators where we can train TEVAR, TAVI, and all these new catheter-based technologies, as well as the Maastricht simulator for minimal invasive endoscopic and robotic heart valve surgery, as you will appreciate on this slide. Open and closed chest minimal invasive simulators where you can bring along your team, your nurses, your surgeons, and exercise the setup. Chamberlain simulators, beating heart simulators where anastomoses are conducted on the arrested and beating heart. And then we work with an Australian team to assess the anastomosis, send them there, they get imaged, they get scored and analyzed in a very detailed way. So a surgeon or trainee can monitor his performance and improve his technique over time. Same goes for endoscopic vein harvest, EVH, lung surgery. These torsos feature quasi-realistic schemes even. And this is the group simulation for TAVI, TEVAR, and the Menti simulation, and even PCI. With that, I came to close my presentation at this point, and thank you very much for your attention.
Thank you, Professor Kofidis, for sharing your expertise in this session. Next, we are going on to Dr. Chang's presentation. Dr. Todd Chung is an emergency general pediatric specialist who graduated from the Keck School of Medicine at the University in Southern California and is currently working as a director of research at the Children's Hospital in Los Angeles. Dr. Chung, please.
Hi, everybody. My name is Todd Chang. I am Associate Professor at the Keck School of Medicine at the University of Southern California, and I work as an attending physician at Children's Hospital Los Angeles in the Emergency Department. I also function as the Research Director for the CHLA Las Madrinas Simulation Center, and it's through this lens that I get to talk to you a little bit about healthcare simulation, virtual reality, and the metaverse in healthcare. As an educator at heart, your learning objectives are to describe 4 different domains of metaverse in healthcare generically throughout your hospital, my hospital, and globally. We'll discuss the precedent to which metaverse and healthcare training first arose. And finally, we get to identify 3 specific ways, of course there are many more, that the metaverse will change healthcare. And primarily, we all know this, but I think it should be said, the metaverse is there that changes context. That's the whole purpose of being in the metaverse, especially in healthcare. And the context is what drives different changes and different new possibilities. And what we mean simply is that in a typical healthcare setting, you can change the context once you get into the metaverse. It could be a change in the context around you, a place that you normally would not be there for, or you can even change the context of you or the patient or the other surrounding people or creatures that interact with you. And this actually has quite a few benefits if you can think of, especially for children and families. When we first used virtual reality in 2016, we knew that the virtual reality work and the metaverse in healthcare had about 4 different possible uses. 2 of them are towards the patient, really the context of the patient is what's most important, and then the other 2 are provider focused on the right-hand side. The context is more aimed at the provider, the doctors, the nurses, and other healthcare professionals. And we'll describe one at a time. This is therapeutic escape. You can always change the context to somewhere that you'd like to be. Maybe a beach, maybe somewhere therapeutic, somewhere where it's less anxious, more calm, or more productive in case. And this is called therapeutic escape. Alternatively, you can control the context in the metaverse through um, something called therapeutic desensitization. And this is a virtual reality software developed by Mindwave in London, the UK, that illustrates this concept. This is a phobia simulation wherein people who have phobias about dirty bathrooms or dirt in general, germophobia, are placed in this virtual room until the rooms start getting dirtier and a little dirtier and grungier and a little bit nastier until they are pretty much holding their breaths. And essentially, it's a form of PTSD or post-traumatic stress disorder therapy by desensitization. It's actually been used quite a bit for the US military as well as those with anxiety and phobia disorders. So we know that not only can you take them to somewhere wonderful and relaxing, you can put them in a controlled environment and controlled context in the metaverse. And then there's the provider side where we have a lot of different ways to look at and visualize different elements in healthcare, in this case in open surgery. So this is an example of provider-focused 3-dimensional visualization where we can share our own eyes within that metaverse. This can also be not just video, but in rendered computer animated products such as the Stanford Heart, which is a congenital heart simulator. For those of you not in pediatrics, congenital cyanotic heart diseases are those where the infants and newborns are born with heart diseases that require immediate surgery or immediate palliation. And so the complex anatomy is very difficult to talk about, even draw on paper. And so this software is used to allow people, including providers, physicians, nurses, surgeons, and even families to really delve into exactly what's going on with the heart. So that's an example of 3-dimensional visualization. There are other forms of simulation that's also done where you can totally immerse yourself into a constructed virtual hospital or hospital room. This is a software called a Catechus that uses just the software as well as Zoom during the pandemic to do simulations. This is called the simulation training or assessment. And there's a lot of different softwares for surgeons and other people as well. And we'll talk about some of the things that we used at CHLA. all in all, the whole purpose of the metaverse is to really connect you to the patient, the physicians, the nurses, and all of the people in different healthcare arenas, not just for telemedicine, but really to create a new virtual environment. And so this is really exciting for what we get to do in the metaverse. We've all heard this story about the patient who was on her last trip to the hospital, and she requested the ambulance to take her by the ocean because that's where she made her. That's where she was the most happiest. And what this illustrates is that the context is really important, right? The real ocean context was very important to her, and the context can be changed in the metaverse as much as we'd like. Maybe it's the ocean, maybe it's somewhere different, maybe it's less people, more people. But the entire concept of the metaverse transcends what we can do in real patient care interactions. A little bit about our experience. We started in the healthcare education world when we ventured into virtual reality and then therefore to the metaverse. And what we wanted to do was to create a fairly realistic view of our trauma room. So on the left-hand side is trauma room 2. Trauma room 2 is where we have our large-scale traumas. You can see that most of the things are already prepared. And these are animators from BioFlight VR that we contracted with during our development in 2015 and 2016. And they have essentially rendered all of the real products that you see here, a non-rebreather mask on the below. We also decided to digitize ourselves, so we play different nurses and physicians, and you can even recognize within the virtual reality some of the movements and hand movements that are very characteristic of experienced nurses and even experienced physicians. So we wanted to change, we wanted to transport everything that was live into the digital world. And so the screen actually looks like this, and as you can see, the wood floors and all of the furniture and the carts are pretty much the same carts that we have in the hospital. And so what we've decided to do in the metaverse is to really replicate what we have exactly in the hospital system so that we can actually do simulations in there. And our first step was training. And so I'll show you what that looks like. I will show you what that looks like in a moment. We developed a patient physiology changes just using simulation education principles, and most of us in medical education and nursing education know how to do this as well. And so all the patients change depending on what you do within that particular metaverse.
Why aren't you doing anything?
Code red, third floor, nursing station. Code red, third floor, nursing station.
You're going to lose him
Code
if
blue,
you don't do
lobby
something
main
now.
entrance. Code blue, lobby main entrance.
You need to give a medication.
Oh, why aren't you doing anything?
Code red, third floor, nursing station. Code red, third floor, nursing
Why aren't you
station.
doing anything?
Code blue,
You need to give a
main
medication.
entrance. Code blue, lobby main entrance.
The Ativan has been given, but the child is still seizing.
I hope that was relatively stressful. We designed that simulation to invoke a fair amount of stress. Even though the algorithm for treating an infant with seizures is relatively straightforward, we designed this particular world in Metaverse to simulate what it's like to treat an infant in crisis in status epilepticus or active seizure. For those of you who know those tones and are getting a little bit nervous from them, I apologize, but hopefully it illustrates the realism that we can make in here. So using this as the prototype, we have actually next steps for the metaverse, or what we think will happen in our hospital as well as your hospitals as well. And there's three things that we foresee. there's many more than this, but the three specific items are that the metaverse can control physiological stress depending on the context that you have. We created a context that was purposefully stressful, but we get to control the amount of stress. Number two, the metaverse can change identity perceptions because you cannot inhabit the different avatar. You can look very different. You can interact with other people without really knowing their true identities, and we can change them anytime that we want. And that can be really good for particularly children. And finally, the metaverse allows you to transcend a real patient into the digital. Just like we uploaded our movements to the digital world, so too you can actually upload a real patient into the digital world so that you can interact with them, study them, as well as find out what the best treatments might be, even if the real patient is not particularly logged in. So the metaverse can control stress, number one. We know this from some of our work when we used virtual reality in this particular simulation, and we were able to find that stress physiology that's measured with heart rate variability, and even salivary cortisol levels actually changed a little bit with virtual reality, but not quite as much as real situations. For those of you who were in emergency medicine, you know how stressful those types of situations are in the real setting. And we found that in virtual realities that some of the stress was there. So a little bit of the heart rate changes were present, but not quite as bad as the real thing in the emergency department. We also found that stress physiology changes depending on whether you're experienced or not. So the context can be tailored to whether you're a novice and you've never seen it before, or that you're an expert, that this is something that you might be desensitized to already. And so we use the same principles of PTSD phobia treatment as you might do for the metaverse training for physicians and nurses. VR can change identity perceptions, and this has a lot of implications depending on what part of the globe that you're in and what part of the world that you're in as well. In the US, this is particularly germane to the diversity, equity, and inclusion movements and the Black Lives Matters and Stop Asian Hate movements that have arisen since 2020. This may not be as important in other areas, but we wanted to highlight what it's like to actually work on these. This particular software that you see here is called a 1000-cut journey. This allows you to inhabit the body of a young black male, walking around schools and really experiencing the world through his eyes and his shoes. This type of embodiment has actually been shown to reduce implicit bias in a variety of different ways. And other examples such as the domestic violence simulator, where any number of people can experience what it's like to be a woman in a domestic violence situation. Here's an example of a man directly engaging at you within the virtual reality environment. And another example of a harassment training where you can inhabit any of these 6 characters, including the woman who on the upper left who will be harassed, unfortunately, in this simulation. Um, Depending on who you inhabit, you actually have different feelings and different reactions to what's happening. And so identity perceptions is actually very important, and virtual reality, as well as the entirety of the metaverse that you get to construct the context, will have a really big implication in these types of relationships, despite wherever you are on the globe. And so what this means in healthcare is that there's a variety of different people that can inhabit what their patients are like, what their families are like, what our colleagues are like. And this may actually have a wonderful added bonus within the metaverse where we truly get to understand what everyone else is going through. And finally, the metaverse is meant to transcend the digital. We have a lot of analog solutions, a lot of papers, and a lot of records, but ultimately, we want to be able to put the patient up into the cloud, really. And so, in the same manner that parents can have organ donations for their children, or an adult can decide to be an organ donor themselves upon death, we actually ask while the child is still alive whether or not we can use the child's health data to create a simulation off of them. And for a lot of families whose children have gone through a lot, most of the families actually like this idea. They want the doctors and nurses to really know what it's like to take care of their really ill or sick child. They've had to deal with it their whole lives, and the physicians and nurses need to really know the particulars and the specifics of their kids. And so one of the ways to do this is to really use their health data to craft a simulation. Right now, we use it to craft a mannequin-based simulation with some vital sign changes, but there's no reason we can't go into the virtual world or the metaverse to recreate the patient as is in the metaverse. And so what we have then is a replica where, for training purposes, you can actually allow for different people to train depending on what happens to the child or the patient. And the metaverse allows us to use digital copies of our patients in a safe and effective manner for training purposes, and likely will be able to be used for clinical care as well. So those are some of the thoughts so far about the metaverse. I wanted to thank you for your time, and this is my QR code to my email. Now, I'm sorry I couldn't be there in person, but please feel free to email any questions or comments, and hope to hear from you soon. Thank you.
Should I start?
Yes, please.
Thank you. Okay, I'm sharing my slides. Can you see my slides? Okay, I'm very I'm very happy to be invited to the International Healthcare Metaverse Conference 2022. This is a really a new era for the innovation in healthcare, and I'm currently from Seoul National University College of Medicine and Seoul National University Hospital. And today I will talk about a little bit about my experience in digital surgery and metaverse. I'll start from the this concept slides that from recent couple of decades, everyone knows about the concept of translational medicine, which merge between the bench to bedside, as we said, from bench to bedside. We have collaborated with the PhDs and medical doctors to improve the patients' their outcomes in especially in biotechnology. And now, as everybody knows, that the bench and bedside in the same size, and in the other side we have the computing. So the merge between the medical and healthcare and bio with computing, we can say that it could be the digital transformation of healthcare, and in short term is the digital health, what we care about today. So there's a couple of areas that benefit in the digital transformation of healthcare, and I emphasize every time that the benefits for the patients is of course most important thing, but also it's not only the area that benefits, and it's for the benefits for the healthcare, and also it benefits for the clinician, which include the clinical decision supporting systems, and I will talk about a little bit about the clinical performance enhancement systems in surgery. So for years and decades, it starts from the personal computer. When I was in the medical school in in 1990s, we had the keyboard and the World Wide Web and etc. But from then we have evolved. So nowadays it's called that we have in the fourth wave of the digital innovations, and it could be metaphor as a metaverse, which include AR, VR, and hopefully 6G or 5G telecommunication network, and all things including blockchain and NFT kind of things could be included. And in healthcare, we have the digital therapeutics and software as a medical device is included in this new wave of the digital innovations. So everyone might know that the start of the definition of metaverse. So the global trend in the whole, not just the healthcare metaverse, but recently there was a report in Precedence, a research that it from now is $40 billion a year, and the market size will surface 1,607 billion in 2030. And so there will be really improvement in every areas. And we have 4 elements about the metaverse. So there is a virtual world, and in virtual world comes to the real world, and it can be have the areas like augmented realities, live logging worlds, and mirror worlds, and the virtual world itself. And the medical augmented reality application could be divided into like these 4 areas. Previous presenters have already talked about the examples of a beautiful their implementation of medical XR or metaverse to the these areas. This is one of video from also VR, so it could be used as education or training to improvement of the providers. And also we have several the areas. One of it is the pre-procedure planning. To have in difficult surgical performance, we can use the medical XR to simulate the anatomical references in together to simulate the operating room or the operation itself before the real procedure. And also we can implement the AR in really in intra-procedure as a application. So there's several companies which now have this kind of augmented realities. So you can use it as a guidance to go for the procedures. This is a great way to navigate. As you see that the maxillary sinuses, there is very complicated anatomies, but with this the SLAM and technology and navigation, you could use this as a exactize and localize the exact location of the regions. And you can see that with the 3D reconstruction of the previous images, it could help the surgical procedures. For myself, I am an endocrine surgeon, and I do the robotic cell surgery, which is called the BABA approach. You can see I have implemented the intuitive Da Vinci system since 2008. This is a short video of my operation. You can see the instruments of the robots doing the CEREIT surgery is same as the open surgery, quite nicely. So I have had a great time to implement this new technology to improve the patient outcomes altogether. And with this new type of surgery, I published the Atlas of Cell Surgery and also worked with the Da Vinci in 2D company to make a procedure card for the BABA surgery. And as the robotic surgery or the laparoscopic surgery, we have the videos of the surgical procedures. I've worked with some of the students in the engineering department that the AI could be implemented to guide the surgery. This is the thyroid surgery with the robotic system, and as you can see, there's a lot of small organs that could be possibly be identified carefully. And this is the parasite, and it is not easy to identify the parasite during the thyroid surgery. So I asked the student in engineering department, so whether we could have used the AI system to detect the parasites, like you can detect the lung nodule in chest PA. So he have developed this algorithm briefly to look at the parasite, and it can be identified in the color code that the instrument is in red and thyroid is in the light blue. And if you can see here, we have the a little bit dark blue that indicate the parasite. So identifying the important structures with the AI could be a great way to improve the surgical result, and it is a part of the Metaverse to improve the reality to the augmented reality. So we can apply the AI in surgery, especially in intraoperative guidance. So preoperatively, we take the a lot of a series of the imagings, including ultrasound, CT PET, MRIs, and etc. So using artificial intelligence, we can shape and reconstruct this into 3D shape. And also with other AI technologies, we can have the structural mapping, and it can be implemented in the endoscopic or laparoscopic navigation. So it involves like camera localization, 3D environment mapping, which is like SLAM. And also we can have the feature tracking. So in some of that, we can use it as the optical biopsy tracking. And also with the image registration, the AR could use as a visual guidance. So extended reality include the AR and MR, and it have different definitions, but I will emphasize one of the key components of the augmented reality, which is the registration between the real world and the virtual world. So you could be used to the concept is like this. If you have these videos, as you move the real world hand, the earth moves into the registered the shape of the hand. So it should be very important in the surgical guidance with augmented reality. Like we need reconstructed like 3D river image in the real surgical field. It could be registered exactly into the position. So I have also a collaboration with engineering department that to use this concept to thyroid surgery. As you can see, in thyroid surgery, we have a parasite. Also, we have trachea and nerves, which is very important and critical anatomical structures. So we have reconstructed the trachea and also thyroid with the preoperative CT scans and registered to the actual images to improve the quality of the operations. Also, in our Seoul National University Hospital, we have developed the central catheter insertion digital twin MR. We use the Unreal MR glasses and also Microsoft HoloLens. As you can see, we can use the preoperative 3D scans of the major vascular structures to important insertion of the central catheters. And recently we have reported to the World Journal of Surgery. Also, it can be used to as a teleconsent. Sometimes we need to consent with the in the waiting rooms between the surgical rooms. So using the MR, we can share the endoscopy or the laparoscope view and annotations. So recently, it has been published in scientific reports, and so medical staffs can ask consent from the caregivers in OR that a caregiver can listen to the surgeon's explanation through MR glasses and outside of the OR in waiting rooms. I will shortly introduce about our division of smart ICT research. It combines the medical and ICT in pursuit of the realizing digital healthcare. We have the medical XR studio, which have been compromised about co-work studio, observation room, and 3D capture studios. Here we have accompanied several research services. One of it is a volume laser and creation of prostate VR simulator. We have made this VR simulator to help the trainees to improve their skills in the laser inoculation prostate simulators. Also, we have developed appendectomy digital twin VR simulators. So we can use this VR model to have the scenarios including the major appendicular windows, coagulation, and division. And in the last place, we can have the bag extraction. So you can improve the trainees of the surgical skills in the laparoscopic appendectomy. And also, we made a Metaverse operating room to improve the trainees to more apt to the surgical environment. Instead, going into real operating room, they can use the AR to be in the real presence. This video shows a little bit about the so the trainees can use the several kinds of the head-mounted devices, and they can go into the Metaverse surgical room to have their OR settings, so they can use their hands to grasp the virtual trainee, the model to have what I have previous used the appendectomy training sets. So everyone nowadays could not drive a car without the navigations. Or nowadays the cars have a lot of ICT technology inside. So in the future or in the nowadays, so it can be used as well as in the operation room. So this could be a future the clinical center and collaborating with the computer center that in preoperative workups, the patient come in and we have the medical imaging as nowadays, but it can be go to the computer center and it can be the transformed to the patient center 3D modeling system. And there is a component of the XR technology, which include the image registration, segmentation, and camera tracking. So the navigation platform comes to the operating room, and it could be patient-centered precision surgery that can improve the patient safety in the OR. So in conclusion, with the help of the AI, XR, and telecommunication, we can improve the surgery to patient personalized precision surgery. We can improve patient outcomes. So surgical innovation is the patient care, and surgical innovation is not a past thing as we all believe, but it's current work and convergence of IT with health technology, which is the digital health, would give more opportunities for surgical innovations. Thank you for your attention, and I welcome questions and discussions. Thank you.
Thank you, Dr. Lee. That was Dr. Lee from the head of the Seoul National University Medical Big Data Research Center and Professor of Surgery at Seoul National Hospital. Dr. Lee, greetings from Dr. Jaydeep Rao of Singapore as well. Thank you. Now, the next presenter will be Dr. Ralph MacKinnon. Dr. Ralph MacKinnon is the founder of the Northwest Simulation Education Network and has served as the director of International Pediatric Simulation Society. He's currently a director of resuscitation at the Royal Manchester Children's Hospital. Dr. MacKinnon, please.
Thank you so much for this opportunity to address this prestigious meeting. I would like to give a presentation. I'd like to give a presentation that perhaps takes a instructional design view in terms of looking at this from how we organize ourselves, not just within a hospital, but perhaps organize ourselves as a city. So I work and come now from Manchester, which is Greater Manchester, which is a large city in the north of England. And we have had the good fortune to be in a position to embrace the principles of the metaverse. And perhaps it is useful now to take a helicopter view. My wife is a helicopter emergency medicine doctor, so let's take it, instead of diving deeply into what we do, let's just look at how it's been organized in our city. But first, some declarations. I have had the good fortune to be funded by, I have a background in technology enhanced learning, good fortune to be funded by Lærdal Medical of Norway. And I'm the CEO of Health on Cloud in the UK in Greater Manchester, which is a centre that promotes collaboration between the United Kingdom, Korea, and global partners to enhance patient care and patient safety within the metaverse. So our city, we have a mayor who was the previous health secretary, and the concept is to create an ecosystem throughout our city that embraces the metaverse. There's been a £5 billion investment program, and we have a mayor who's completely committed to achieving these goals. And we really, we leverage, of course, we leverage finances, but we really leverage our people. And we put a lot of focus on the talent that we have within our city. So how, from the political level, how are we organized then to actually create this in terms of academia and industry and healthcare coming together? So in Manchester, we're one of the 15 centres in the United Kingdom that is a academic health science network. And we have what we call Health Innovation Manchester. It is led by Professor Ben Bridgewater. Again, this is the key cornerstone for our life science work in the city. And hopefully you will see that it embraces a number of organizations. The concept, again, is to promote innovation and to partner with industry in providing that. And I go back to one of our first presentations. The partnership with industry is absolutely key, and it is something that we need to evolve, learn how to work together. So our city is organized in digital clusters. We have two. We have one, which is we call the Oxford Road Corridor. It is the main artery that flows through our city. We had the good fortune of having colleagues from Korea, Dr. Chung and his team, to come and visit us. And it was easy to walk down this artery to see how it moved from being university academia, merging into hospitals, merging back into academia, straight into the heart of the city. And also we have, and on this corridor, we have the Manchester Foundation Trust, which is my hospital, but we have Manchester University and Manchester Metropolitan Universities, these are high caliber universities. There are laboratories populated within these universities, and then digital hubs going out from these universities. And that is through the center of our city. And then we also have a media city, which is the BBC, which is obviously the British Broadcasting Corporation, relocated from London many years ago, and became part of Media City with other media outlets. So all of our creative hub for the United Kingdom, a lot of our creative hub comes straight from here at Media City, which is very close to another of our huge hospitals, which is part of the Northern Carolines, which you'll hear about in one of the presentations that's coming. And key to this is that it's linked to the University of Salford, which produces a lot of metaverse orientated talent for our city. And our hospitals. So we have Europe's largest single site hospital on the digital corridor, and then which has a group of 10 hospitals in this partnership all throughout the city. When I say city, I call this is Greater Manchester. And then in Greater Manchester, we also have the Northern Carolines, a further 4 hospitals, and one of those hospitals, which we'll hear from in a moment, is Salford Royal Hospital, which is one of the first hospitals to enable, to really grasp digital technology in the United Kingdom. And finally, we have the world-leading cancer hospital, which is the Christie Hospital, where I have the good fortune to work in the Proton Beam Center. It's a pediatric and adult, but a pediatric proton beam center. And we very much hope that we can leverage our experience with respect to creating instructional design components for simulation and for metaverse virtual reality within these hospitals. So aligned to them, obviously, we have a number of high caliber universities, all of which, as you can see down the side, are focused on the key components that we need the talent to be orientated towards with respect to from machine learning, from technology enhanced learning, from coding all the way through to cybersecurity and data protection, which is absolutely key if we're working inside a healthcare sector. But as I said before, this ecosystem is absolutely dependent on talent. We have to have a continual flow of students who are then doing masters, PhDs, or coming into organizations such as those at Media City, which will orientate them into startups that span out from our digital clusters. So just to end, we are going to touch on some of these initiatives in other presentations, but one of our current initiatives now is to create a children's hospital or kids digital laboratory. This is really important because we want to promote the community of practice that I talked about at the start, where we get throughout the hospital, instead of just a micro part of the hospital focusing on VR, we want to try and get everybody that's interested to work together. And that is key, but also the governance side of this as well. We want to try and produce the highest standards of use and of direction of the innovation that the metaverse can provide. We are part of the collaboration with Dr. Lee and Dr. Chung from Los Angeles and our colleagues in Singapore with respect to basic life support studies. And we have in the process of doing virtual reality CPR studies in schools and hopefully taking this into the community, which we will touch upon later. So finally, what our real goal is to co-create, to create content that is of value on the metaverse, and to do this with partners. And these are partners in industry and partners globally. And we have a long history of collaborating internationally in our organization, and we want to continue that with respect to the opportunities and embrace those that the metaverse provides. And you can see that our goals are both undergraduate and postgraduate. And we really focus in our hospital of training people where they work, when they work, with whom they work, and really importantly, trying to create team, not just individual based metaverse solutions. And we are And just to end, I would say that we are extremely open to collaborative opportunities, and we would like to embrace them. So I thank you for your time, and I hope we can dig deeper into those in later presentations.
Thank you, Ralph. Our next speaker will be Dr. Hong. Dr. Sang Hong is an expert in respiratory diseases and critical patient treatment, graduated from the Busan National University Medical School, currently working as professor of internal medicine at Asan Medical Center in Seoul. Dr. Hong, please.
Hello, everyone. I'm Dr. Sangbom Hong, working in Asan Medical Center. I'm chief of simulation center. Today, I'm going to talk about AMC experience of VR. This is a VR timeline. Our center, I divide the stages. Stage 1 start the simulation center of CPR 2002. And 10 years later, we extended more patient safety. So stage 2 simulations, education of patient safety. 6 years later, stage 3 plan for education for VR and AR. So 2019, we made the first VR content, the T-Canula event. And next year, we made second VR emergency situation at General Ward for beginner nurses. 2020, we made the VR EduPlanet in our center. One team VR room, one and 5 personal room, small room. And the third VR was a basic mechanical ventilation for beginner nurses. And 2021, we bought CPR VR machine and the body interactor computer-based program. And this year, we are making some programs. First is sepsis management, doctors and nurses, and the other is ACLS VR program. Compared to 2012, participant increased 250%, and education session increased 500, and curriculum increased 400%. This is a VR EduPlanet in our center, and the entrance, and the big room, and the small room. This is the first T-Can VR. Let me show. This patient complained dyspnea, and put on the pulse oximeter and measure blood pressure. Patient still complain dyspnea, EKG monitoring and increasing oxygen. Check the oxygen supply. Still, he complained dyspnea, so operator determined back apply. So removed T-Canula, T-Can oxygen there, and apply back like this. Actually, T-Can VR, many participants, immersion and reality, what should I do like that, and do it very actively. No sleeping. Actively participate. The next VR is the first 5 minutes for junior nurses. Identify acute ill patient and notify an initial nursing intervention and prepare intubation. 팀워크 어프로치 시니어 너스 이제 lung sound and continuous monitoring, pulse oximeter, and ask, are you okay? Drowsy mentality. So next is troubleshooting during mechanical ventilator for beginner nurses also. Applying mechanical ventilator and alarm happened, so what should we check? Chest radiography, E-tube, tip of endotracheal tube, and some embo bagging and suction like that. This is a CPR VR machine. We are doing staff education. During this time, we applied 625 satisfaction score, amazingly 4.9. Another, we are using computer program based education. We bought a body interact program and made by protocol. Total case, we are 6 scenario using. This is current our result of VR, TCAM VR, first 5 minutes VR, Beijing mechanical ventilation VR, CPR VR, and body interact program. All satisfaction score is very, very high compared to user simulation. So this year we are making sepsis simulation training program. We are using new national early warning squad, and the goal is 1 hour bundle and team approach, doctor, nurse. We are approaching all onto medical student also. Another is ACLS simulation training program, and is international guideline, you know, ACLS, so followed that. This is a summary slide. Simulation education, including VR, is increasing. Participants really satisfy VR education program. So we need more clinical solving programs and budget and technical improving. Thank you for your attention.
Thank you, Dr. Chung. The next speaker will be, sorry, I lost track a little bit. Sorry. Yeah, Natalie Garrett, right. The next speaker, I don't have it here. The next speaker will be Natalie Garrett.
Good morning.
Yeah,
it's a pleasure to be.
Sorry. Yeah, Natalie Garrett serves as the R&I Partnership Manager and Business Development Manager for the Northern Care Alliance NHS Group, and as the Head of Innovation for the Northern Care Alliance NHS Foundation Trust. Natalie, please.
Good morning. It's a pleasure to be asked to join you this morning and to tell you a little bit more about my organisation, the Northern Care Alliance NHS Foundation Trust. Let me introduce myself. My name's Natalie Garrett and I'm the Head of Innovation for the NCA. The Northern Care Alliance NHS Foundation Trust, or NCA, was formally established in 2021, joining together 2 existing hospital providers in the northwest of England. The NCA is one of the largest NHS providers in the country. In 2021, we spent around £5 million per day providing health and care services. NCA provides a wide range of hospital, community health and care services to over 1 million people across Bury, Oldham, Rochdale and Salford boroughs, as well as specialist care to patients from Greater Manchester and beyond. Our aim is to deliver consistently high standards of care to all our patients and service users. Patients may be visiting one of our 4 hospitals or receiving a range of integrated health and social care services at their home or in the community. Our mission is saving lives, improving lives. Over the next decade, it's our ambition that the NCA will become the safest and most effective organisation in the NHS, with excellent outcomes and experience, improving health and tackling inequalities in all of our places. And we also, critically, want to be the place that colleagues want to come and work. Let me tell you a little bit about our people. The NCA has around 20,000 staff based across our 4 hospitals, community services and social care. And of those 20,000 staff, around 4,500 are those staff based outside our direct care teams, ranging from plumbers and electricians to operational management, digital, corporate services and research and innovation. As you would expect, the majority of our staff are working directly with patients and service users. With so many staff, we are one of the largest employers in the region, and the Trust has a significant role as an anchor institution within the local economy that goes far beyond our role just as a provider of health and social care. Let me tell you a little bit more about where we are. These are some images of our 4 places within Greater Manchester, and it's very easy to paint a beautiful picture of our region, as I've done here. There's certainly a lot of beauty to be found. Here you can see the East Lancashire Steam Railway in Haywood, the beautiful Bridgewater Gardens in Salford, just down the road from where I live, Duffstones Reservoir and the Peel Tower. But this only represents a small proportion of what our region faces. There are also heavily urban areas experiencing high levels of deprivation. The health of people in 3 of our areas, Oldham, Rochdale and Salford, is generally worse than the average in England, with all areas being in the 20% most deprived districts in England, and over 20% of our children living in absolute poverty. Life expectancy and healthy life expectancy for men and women across all our localities is lower than the England average. And within each of our 4 boroughs, life expectancy can vary by around 10 years for people living in the most and least deprived areas, a stark statement of health inequalities. All those factors play into everything that we do as an organisation. Our 4 hospitals and community services provide a wide range of care for more than 1 million people across Greater Manchester and well beyond. This ranges from midwifery and health visiting services for our youngest residents, through a range of general and specialist support for all ages, to adult social care and specialist support for older people. We provide a number of specialist and highly specialist services to the people of Greater Manchester, North West England and beyond, including neurosurgery and complex spinal surgery, complex GI surgery, trauma and orthopaedics, renal medicine, dermatology, intestinal failure, musculoskeletal conditions and more. Salford is the major trauma centre for Greater Manchester, and a new trauma hospital will be completed on the site in the summer of 2023. As you've seen, the NCA is a large organisation which works closely and collaboratively with a wide range of other partners and stakeholders across Greater Manchester and beyond. These include our fellow NHS organisations like MFT, who are also represented here today, local authorities who have particular responsibilities for population health, public health and social care, universities with whom we collaborate on clinical training and research programmes, including the University of Manchester, Manchester Metropolitan University and the University of Salford. The third sector, including a wide range of charities and voluntary organisations of all sizes, and industry, ranging from small local companies to global pharmaceutical companies. Digital is a key enabler within the Trust. Our Salford site has been using electronic patient records for over 20 years, and along with a suite of other digital solutions is largely paper-free. Since the Trust merger in 2021, work has been underway to roll out this technology across all our sites, with an upgrade at the same time. Critically, there is a strategic commitment across the organisation to using digital technology to deliver excellent care. However, this does have to be done with some care to avoid the natural inclination to be attracted to shiny new things, or what I often refer to as the magpie problem. Digital technologies must not be the driver to how we approach care for patients. They should be the enabler. When I met with physiotherapy colleagues a few weeks ago, one of them summed it up as, "Don't go for expensive technology if a rubber ball will do the job." The joining up of all our digital systems enables staff to work seamlessly across sites and in community settings, improving patient safety. Having this robust infrastructure in place has allowed some rapid developments to support patients at home during the COVID-19 pandemic, including advances in patient held and updated records, remote monitoring and virtual wards. The challenge now is to evaluate these interventions and determine whether they form part of our business as usual or whether more work is needed. The Trust supports apprentice and undergraduate students from higher education partners across the region, ranging from porters and plumbers to nurses, allied health professionals and doctors. Ongoing training for a variety of professions is also supported, along with skills and mandatory training for all members of staff. The Trust has state-of-the-art learning and education facilities, including a simulation suite, and new developments in using VR and AR technology to support learning in partnership with universities. So let's take a pause there. I've told you a bit about our organisation. But what do we want to do and how do we want to innovate in the future? Innovation should always start with the needs of our patients and service users and the suggestions of our frontline staff. Innovations that are pulled into an organisation based on need are far easier to evaluate and ultimately can be implemented much more successfully. I'm going to give you some brief examples of areas of innovation within NCA that I think will be of interest to colleagues here today and offer opportunities for how we can collaborate and share. These are all driven by identified needs within our organisation. The first area is 3D printing and visualisation. NCA's expertise in 3D printing to support bespoke clinical requirements has been developed through research and innovation projects based on identified clinical needs. The Trust has now established a unit to support these requirements and is actively looking for wider opportunities. The three images on this slide show the use of 3D visualisation and printing for surgical planning in patients with particularly complex issues. These enable the full surgical team, including the anaesthetist, to carefully plan and, if necessary, practice the surgical procedure and airway management before taking the patient to theatre. The second main use of 3D visualisation and printing within the NCA is to support safe surgical positioning. Let me introduce you to Helen. She had severe ankylosing spondylitis. The only way to restore the alignment of her spine and lift her chin off her chest was to break her spine and straighten it. The procedure lasted 15 hours, and the surgical team knew it would be extremely difficult to position Helen safely on the operating table, protecting her airway and reducing the risk of pressure injuries, whilst keeping her in the best possible position for the team to carry out the procedure. Several hospitals had already told Helen that they couldn't carry out her surgery. The NCA has a track record of carrying out these types of difficult procedures, but in the past this would have involved several pre-operative visits for Helen, who lived over 100 miles from the hospital, and some periods of considerable discomfort in trying to achieve good positioning on the operating table while she was awake, also taking the operating theatre out of use for that period of time. Imaging technology was used to create a digital model of Helen's anatomy, and this was then used to create a bespoke positioning device that was bolted to the operating table. The team visited Helen once to check that the positioning model was a correct fit. Helen's surgery was able to go ahead without any awake pre-op visits to theatre, with her airway secured and her position braced. In addition to the enormous benefits to the patient of a safer surgical procedure with less travel and inconvenience beforehand, there are huge benefits to the organisation. You can get 10 hours of biomedical engineering expertise spent visualising and producing prototypes for the same as it would cost for 12 minutes of theatre time. The final example is creating complex 3D visual models from imaging for patients with complex airways or other anatomy. These images are from patients with MPS, who often have severe deformities of the airway, making intubation extremely difficult and risky. Visualisation and modelling of the airway allows the anaesthetist to plan and practice the intubation. This type of visualisation is also being tested with neurosurgery, with the surgeon able to practice virtually using the images beforehand and then overlay the imaging in their goggles during the procedure. AR and VR solutions are now slowly creeping into use across our organisation. The main areas being tested currently are with operating theatres and labs, either live for the overlay of imaging and other data during procedures, or more frequently for training use and for training simulations, whether in particular skills such as NG tube insertion, or for scenario response, such as within major incident training. This is a key area that we want to develop further, working collaboratively with our clinical teams, research teams, and learning and development teams. It's also an obvious area for the sharing of training and clinical materials, particularly for those things that are either very common, such as NG tube insertion, or very rare, such as the surgical removal of a chordoma. Finally, I wanted to touch on our work with academic partners to explore and trial the use of innovative materials in healthcare. The most high-profile one of these is graphene, where preclinical testing is underway for a variety of uses, and where we will shortly be starting a first-in-human surgical trial using graphene electrodes for neurophysiology during awake brain tumour surgery. While this might sound like the technology driving the clinical need, it is in fact the other way around. The electrodes currently used to monitor activity in the brain during brain tumour surgery are not as effective as the teams would like, and the use of graphene is being explored to see if it can provide better results. Another key area where we are working with academic partners is to explore the use of different materials for a wide range of equipment and devices in order to reduce their environmental impact. What will the future bring? I think at the moment we're just taking our first steps along the path. We will continue to be guided by our trust mission of saving lives, improving lives, in supporting the development of innovations and improvements that are led by the needs of our patients, service users and staff, and where digital technology can truly be an enabler of improved outcomes. Thank you very much, and if there are any follow-on questions or queries, please don't hesitate to contact me or a member of my team using these contact details.
Thank you, Natalie. The next speaker will be myself. Okay. Good evening. So you're in the room. My name is Anis Ahmed. I'm from Singapore. I'm a thoracic surgeon and also lead principal for Asia Pacific for Health on Cloud. Those are my disclosures. Good. Okay, thank you for this opportunity. My talk is more going to be like Metaverse for dummies, so very simple to listen. So many people have many definitions for Metaverse, and I found this definition to be quite enlightening. I think it's a social construction that leverages the web, the blockchain, and the computer, where individuals build customs, habits, and values, which allows them to spend time and socialize in this virtual world using their avatars. So, and it also happens to coexist with the real world. I found this definition quite meaningful and quite real regarding the Metaverse. What is actually Metaverse? I think it's just the way you interpret data and how it moves on. Unfortunately, I've been privileged to be across all these data collection mechanisms, which is from reading newspapers, and then you move on to cassette recorders. I think many people in this room would not have seen one. If you've seen one, you're on the wrong side. And then you move on to the television, black and white first, and then the color television, and the wonderful discovery of a PC computer. And I think from there, science took a big leap. So then you moved on to the era of handphones, smartphones, and your computers. So your computer, your handphone is so powerful now that it can outdo hundreds of computers from a few years ago. That is where we are. But at that point in time, technology starts to change from a two-dimensional to the next step, which is a three-dimensional. And you got your virtual reality glasses, which is being put on your head. And I still think that is not a completely immersive experience because you have an external gadget which is fit onto your body. And the ultimate experience, I think, will be in the future when you will have a chip implanted in your brain, which will make you a chimpanzee of a different sort, but that is where you get the total benefit of reality. How is Metaverse used in healthcare? I think it is evolving. It's got great potential, I agree. Things like AI, very good example comes from this place. I'll give you later an example. Virtual reality and augmented reality. The Web 3.0 will change things because in the version of Web 2.0, we don't own anything. Everything is owned by Yahoo and Google. But in Web 3.0, we will own things ourselves. So that makes a big difference. So you have the right to own. And the second thing is what everybody talks about is blockchain. So it is a bit more secure environment. There are rumors going around that the blockchain also can be hacked. You can't hack a blockchain, but you can get access to the device which uses blockchain and hack it. You cannot never hack a blockchain itself. So this, along with quantum computing, will take healthcare to a completely different level in the future. I think these are the 4 pillars on what modern technology of the future will run. As I said, will be Web 3.0, the blockchain. By MR, I mean it's mixed reality and the gaming technology, which is now used. I think the Metaverse is the sweet spot which exists in the middle. So that is where the Metaverse really is. And I think that's where the future will be. As far as a surgeon, where do I think healthcare industry will dominate? I think number one, because I'm a surgeon, I'm not saying it will be surgical operations, but it is a critical aspect of a patient's journey in a hospital undergoing interventions. So I think this will be a very, very important field where you will have influence. Mental health, we saw a few examples shown by Dr. Todd, which I will talk about later. Medical education and training, I think all the speakers have talked about it. Okay, so I'm going to be very quick with my talk. So I'll divide into 2 benefits and what are the challenges. So what are the benefits of Metaverse in healthcare? I think the first thing is in medical education and surgical training. Educating doctors is expensive. It's a long process. Governments pay and spend a lot of money. or candidates who can afford it spend a lot of money getting themselves educated in the medical field behind cheap. And the traditional method has worked so far because whatever my father said, I listened to him. But whatever the next generation I say, they don't listen. So it can't be tuition anymore. I preach, you listen, you take, doesn't work. So you have to change the method of teaching and change the method of learning. And I think that'll happen in a virtual real world. And this is the best platform to prepare a surgical student for the surgery, before the surgery, and aftercare after surgery. Let's first start with medical education. I think this is a very good graph, not very clear, unfortunately, but this is where on the, is there a pointer here? Okay, I'm sorry, those on visually can't see, but here, this is, I think there are 4 components to my medical education scheme. First is you have a quality control with virtual reality integration. So everybody gets to see the same content presented in the same way. So one professor somewhere and another professor somewhere else, they do not have any quality disparity. And the second part is you can make it really in real time. You can have a holographic construction of the whole study and bring it into the hall so that a student studying anatomy will really see in front of him a piece of the heart or the lung so that he can understand it better. Okay, and the third thing is that you can make that whole holographic presentation to be processed in a virtual reality world. So you can see it in a complete real world without any distraction. And the last part is what I like, which is you connect it through a computer interface so that you can actually, the end user really gets the full benefit of the whole part of the journey. I think this is where medical education will really benefit from the metaverse. Did I miss one slide? I don't think so, not yet. The other benefit is the therapeutic applications of the metaverse. I think we saw one, which is in my second line, which is psychiatric evaluations and rehabilitations by God. There are new forms of therapy which are coming with digital therapeutics in the VR and AR area, cognitive therapy especially with the newly developed haptic sensors. Even you can do physiotherapy from home, sitting remotely in control. Makes a lot of sense in areas like Manchester, where you have to travel hundreds of miles and you're sitting in one place, you can guide patient at home to undergo. May not really apply to urban environments, to suburban environments, it would be a great benefit. And then there is the rise of telemedicine. Before COVID, the penetration of telemedicine was already there. So there is statistics to show that it was at somewhere between 23 and 42%. Today, it stands at about 95%. So that is a giant leap for mankind, you can say. Everybody accepts telemedicine. Before, telemedicine was not an accepted form. When I can go see a doctor, why do I need to communicate to him through a telephone or in front of a screen? Now it is an accepted part. A lot of auditing companies have already done studies regarding the financial aspects of this. And they've all agreed that the way to go is to consult a doctor virtually before you go see him if needed. So this is bringing a big change. In surgery, so where are we now? I think we saw good examples from Professor Kofidis and co about augmented reality and surgical procedures. I think not only in per procedure, I think in an augmented reality setting, we can have senior surgeons to meet junior surgeons and guide them before they start the procedure. It is not about teaching, but giving valuable experience. So he may be 70 years old, the surgeon, he may not be operating anymore, but he has not lost his brain, hopefully. Okay, and then he can still impart his knowledge to the juniors, but it can be done through a virtual world in a reality setting. So it makes a lot of sense. They can have display of a patient's body, which you saw, vital signs, images, everything. There was a kind of a pathological platform with an AI integrated platform coming from Shanghai, where you can actually have a virtual reality integrated camera, look at a pathology in the body, and the AI machine can read the pathology and tell you the pathology. So that will be the future. Where I am in the operating theater, I shine my VR camera, then I can read the pathology and then decide this requires surgery or not. This is not futuristic. This is happening as we're talking. It just needs to mature, that's all. I am a robotic surgeon, so robotic assisted surgery is, I think, the first step in the virtual world. I sit in a completely 3D environment and operate. I have no touch. I don't touch the patient. I'm connected to the patient by a few cables. The correct word is not robotic surgery. It's called telepresence, telecommunicated surgery, because I'm connected to the patient through a cable, which is already 3D. In the future, there are machines. The next machine which is coming up is called Einstein by J&J company, which is actually augmented reality assisted robotic surgery, where it will not allow the surgeon to make a mistake. So, which is awesome in terms of surgical development. The field which is coming up is radiology, I think, by leaps and bounds. Excellent image visualization, manipulation, more details, 3D constructions. And I think the best program, AI program, was developed in Seoul National University Hospital for pulmonary nodule detection called LUNIT. It can detect nodules and tell you whether it's cancer or not. And the end user cost is something like 30 cents per patient, which is awesome. That is really bringing down the cost of healthcare, which means a lot to the government as well. When they look at something like that, they'll say, yeah, this is great. Okay, so this is how it has evolved over the years. 19th century, it was all X-ray based screening. You know, what was the diagnosis rate for lung cancer from X-ray? Less than 5%, basically useless. So we just burned everybody, did nothing about it. And then we moved to the first LVCT based screening, which happened in Japan. So they were the first country to adopt mass. And then from there, things evolved at a very rapid pace. So now I think 20th century, now you have 3D volume reconstructed radiological analysis. And then we have, I think with the AR, VR technology, you just cannot miss anything anymore. That will be the future to go. Medical wearables in the metaverse, yes. So you already have for sleep apnea, which is there already now. It is available commercially and it costs less than like a couple of $1,000s, where the whole old package used to cost about $5,000 to $6,000. Okay, so it alerts the physician at home, it gives alarms, and he guides the patient. So it is very, very important. Now, this is all happens in real time. And I think when it add the visual element to it, along with the haptics, then you can call it we are in the metaverse. Okay. So what are your challenges now? We talked about all the pros. I'm sure there are some cons as well, right? Now, getting people into the metaverse, okay? So you may make an excellent movie like Top Gun, and you have to get somebody to come and see it. I still haven't seen it. That's the problem. Okay. How will big companies get attracted to the metaverse? So you should not allow what happened with something like intuitive and robotics. You cannot allow Meta to rule the universe. So there should be a lot of more tech companies to come in with the Meta to make the whole field democratic. And I'm pretty sure a lot of companies are in the process of doing this as well. And the second thing is adoption. Can the elderly or less tech savvy really get into the metaverse? Will they change their habits? Do you think they will really feel, your grandmother, will she accept speaking to a screen, or does she still want to be felt by the doctor in person? The physical touch concept, the empathy concept, if you can call it, okay? And then the questions about trusting the metaverse, I think, should be answered early in the conversation for this adoption. If you don't tell people that you can trust metaverse, and which is actually one of the most, it will become one of the most trusted technologies because of blockchain. Okay, and that is why people should know that this is a very trusted platform. So whenever you have money, you have the lawyers there, right? Okay, so we are guided by HIPAA lawsuit guidelines now, and then we have different rights in different countries, and there are so much of diverse laws and lawmaking in the metaverse at this point in time is zero. So who takes the lead? Already FDA has conducted 2 workshops, if you go and look at it. So they're already there talking about it. So if you let only one organization again set the rules like to guide your metaverse, then again, we are in trouble that we just follow what is being told. So I think there should be different rules grounding based on country, but there should be a commonality across how you adopt and how you work in the metaverse. And I think who should control this? I feel that it should be the health data controllers. Health data controllers are the big tech companies. They should work with the government organizations and control this. Once you bought an Apple Watch, once you have a Garmin, you have none of your health data is private anymore. Forget it. You already sold it. Yeah. Okay. Which brings us to the question of privacy and security concerns in the metaverse. Okay. So it's one of the most targeted industry for breaches, which we know. Our country's prime minister's data got stolen. It was news in the country for like, I don't know, front page news for 1 week. We rarely get such one front page news in Singapore, by the way. But you should understand that the price of this data is the priciest in the market. So companies are willing to pay big money to collect such data. And some of the patients consider it to be sensitive. I'm not very sure all the data from all of you is going to be sensitive to me. I don't care whether you have high blood pressure, more sugar in your urine. How does it matter to me? But it does matter to companies. So companies may look at it differently from how an individual looks at it. So that is very important. So developers and the metaverse companies should learn how to keep these data private. As long as it's in ledger, it should be fine. Interoperability. This is the major problem we are talking about. We have in the present day world, as you can see, we have left-hand drive cars, right-hand drive cars, cars which fly, we have iCars, we have e-cars, hydrogen cars. So we should have a commonly developed platform so that integration becomes much easier, because this is somebody's health and healthcare for a country, and it matters. It took Europe to beat Apple down to come down to the C cable after such a long time. You understand? So that should not happen with this kind of technology. And I think unless healthcare industry communicates with each other, with the tech industry, this will be a big problem. The cost, the big bugbear. So I'm sure in the next session, which I'm not going to hold you further, requires really high-tech glasses, gloves, sensors, other wearables, right? All this costs money. Where we sit as a first world country, we can afford it. But somebody in a third world country, can they really afford it? Are we going to make it affordable to them? These are some of the questions. Philosophical, you can call it, but needs to be answered at some point in time if you want the metaverse to be totally embraced. And I think 5G connectivity at least is a basic necessity if you want to do fire surgery across this platform. Lastly, creating a new business model. Present business models don't work. I'm pretty sure that the Web 3.0 and blockchain will revolutionize this. So you need to get a buy-in from your governments. I think a lot of the governments have already eyed this. If we think that they are naive, they are not. But most importantly, it's the healthcare suppliers and providers. And they must accept this, that there is going to be a cost to be paid, and they must be willing to bear it. I think a shared partnership is the best way to go. Lastly, I think will Metaverse democratize medicine? I certainly hope and pray so. If you look at where I come from, India, and where I have lived in Singapore, they're completely two disparities. So there's completely different ends of the spectrum. So even in India, you will find there's high-tech robotic surgery offered in one corner, in the other corner, they can't even hold a blade. So if you have such disparities, how do you bring medicine? How will Metaverse actually equate all of them? Can it really democratize? We certainly hope so, that this works as a platform towards that. I think that is, in a nutshell, what I talked all about. And thank you for listening to me. Have a good day. All right, to close this session, we have our last speaker. I'm going to call Dr. MacKinnon again to come back and talk. Ralph doesn't need any further introduction, right? Yeah.
Okay, thank you again for this opportunity. I get to speak about my passion, albeit very briefly. My passion is resuscitation, and I want to put forward a proposal from myself and Dr. Chung in Los Angeles, where we would like to create a collaborative program of work focusing upon using virtual reality to improve CPR outcomes. And we have deliberately focused on high school children. Just briefly, before I start, just based on the previous presentations, let's talk about need. We know that out of hospital cardiac arrest, the survival figures in my country, about 8 to 9%. I know that in Japan it is lower. I know in Korea it is lower than that. This is published data. I also know that in Seattle, it is 2 times my country's out of hospital cardiac arrest survival. And in Holland and in Stavanger, in Norway, again, higher. So the need is really to understand why we are so poor at looking after people who arrest in our community. I'm talking about people who have a cardiac arrest outside of our community. We know that there are 4 real pillars to this. There's the recognition that someone's having a cardiac arrest and the recognition we have to do something. There is the commencement of doing something, CPR. There is the commencement of putting an AED, that is a public access defibrillator or an automatic electronic defibrillator, to the chest and listening to it and letting it do its work. And finally, based on the first part, the first pillar of calling 911 or calling 999, getting the post-resuscitation care. That is the key. That chain of survival has been shown globally to be the key. It can be for a neonate born in a sub-Saharan community. Still, the principles are there. You try and get help, you try and get breaths into the baby, you try and start CPR, and you try and look after them afterwards. Going to ourselves as adults through pediatrics, the same principles. So again, why are we targeting high school students? Well, we're targeting them, not least because they're the workforce of our future in all of our countries, but also they're very, very tech savvy, and they understand the principles of how to grasp what technology can provide. And also that we know that if we target this community, it will have a profound impact. So globally, many countries have used this as a strategy to improve out of hospital cardiac arrest. So again, I have some declarations that are very pertinent to this. So if we are going to target school children, and we're really talking about those from about 15 to 17, 18, before they go to university or into the workplace, well, we know that globally there are really good CPR programs. There are camps, there are actual programs that are in existence where we can teach, but our real issue is not only the education of CPR, but it's to promote the engagement of CPR. We know in my country that about 43% of people will do bystander CPR, but only 1.7% will grab the AED and use it. So it's about education and engagement. Again, high school students in education and fully engaged in technology. So we know that there are school programs. We also know that you have to repeat your learning. Skill degradation goes at 6 months. You must practice CPR to be good at it. We know that we have used, by using gamification within our own hospital, that we can, and I will touch on this in a second, that we can encourage individuals to get that rolling, continual concept of practicing a really important life skill. And through the work of Dr. Chung, and we have known that we can use technology. In this case, we're using QR code technology, and I'll show you that in a second, how we can create the leaderboard that we created in our hospital, then we transpose this into schools. So we showed that with a randomized controlled trial inside my own hospital, that if this cohort were allowed access to a 24-hour access to a simulator, a normal simulator to practice CPR, there was a possible slight improvement, nothing statistically significant. However, when they were allowed access to the simulator, but also an anonymous gamification, and you can see it here on the this is us using just a wall chart and the numbers put up, and you could recognize your number, how you're progressing up a leaderboard, like a golf leaderboard, like the Open that's happening at the moment in St Andrews. And then you can see that we showed in our organization on randomized control trial that gamification can work within an organization. So we took this to 6 schools around our city, and they had the mannequins placed inside the schools. It rains a lot in Manchester, so inside the schools, but individuals would get a score, QR code, and lift it to an online leaderboard with badges. So then we're promoting this concept of gamification and learning CPR. So in this approach, we had 203 sixth formers, 16 to 18-year-olds. And we wanted to see what their attitudes were, whether they felt this was an important way, whether this would link into their culture and concept of gaming. And there was a very positive feedback to suggest this is the way forward. So our proposal today is to hope we can get some more partners interested in this collaborative approach. The approach previously and the approach that we will now remove by embracing the metaverse was to have a hard mannequin where you could then link to you'd practice your CPR, use your iPhone, then link to a leaderboard. We think that now there is a technology to make this much, much smoother. Hence the leaderboards that we were using. Our proposal is that we would like to do a study where everybody gets access to virtual reality, but you hide the access to the leaderboard as a crossover study. And we will use the outcome measures of CPR technique, and these are the standard measures for, we do, Dr. Chung and myself are part of a network that do a lot of research in CPR, and these are standardized metrics for outcome, but we're also very interested in user frequency, sorry. Our hypothesis is that we think we can sustain and promote learning across a school year. And we think that access to VR CPR training and leaderboard will improve CPR performance in and above just going on a virtual reality simulator. The question is, why not just do a virtual reality simulator versus traditional teaching? I would say why. In the technology enhanced learning world, we went through a really long stage of doing that to prove that actually it is better. And the important work that Dr. Lee is leading now in this hospital through a network is going to answer that question. So I think we can base on that to say that inside the high school, where they're already really accustomed to the use of virtual reality, we should look at something on top of virtual reality to see, and we'll see if we can increase the usage and then also increase the outcome measures that we're looking at. So how are we going to do this? We recruit schools, hence the and others bit. We promote a global competition. We're not lost on us that the World Cup's happening this year. We capture baseline scores, weekly score updates. We can then look at the process of engagement and track people, and then we can look at our outcome measures. And this is where we are. So we have applied for a grant. We have a protocol. We've applied for a grant. We are now at the stage of IRB, and if there are interested parties, we'd be very happy to share all of this with you. And thank you.
Ladies and gentlemen, it's been a long session. Okay, so we'll take a 10-minute break. You can go for refreshments and come back for very, very interesting sessions coming after this in 10 minutes break. Thank you. Ladies and gentlemen, welcome to the next session. I think we had a little bit extended session from the last time. So this time, in the interest of time, can all the speakers please stick to their respective given times, please? Thank you very much. So the first speaker will be from Naver Healthcare Company, derived from Naver, Korea's largest search platform, and began to enter the digital healthcare business in 2019. Mr. Gunha. Thank you.
Thank you for the kind introduction. It's a great honor to be here, Professor Chung and everyone from overseas and Korea. I am Ra. I'm a urologist by trade. I was robotic surgeon for many years. And then I joined the company as introduced 2019 and 20. Those of you who know Naver well, who doesn't know Naver very well, it's a search engine company. We think there's three types of worlds. There's a Google world, there's a Baidu world. I think there should be Naver world. So we are present in Korea and Japan and East Asia mostly. We are today, our stock prices went down today, so we're number 6 market cap company, about 40 billion US. Our operating income is about $6 billion with a profit margin of $1 billion US. Those of you who know our company, our main business is a search engine company like Google. But we have a very strong messenger arm in Line. It's called the Line Messengers, which is #1 market share messengers in Japan, Thailand, Taiwan, and Indonesia. We do have Webtoon, we do have the robotics, we do have ERP, cloud, and financials. So a very diverse portfolio in business-wise. But I'd like to share more about our Snow company, which has been built about 6 years ago. So the Snow is a company builder, but we are very interested and very surprised to find 300 million users in Metaverse and AR and VR, the avatars using all over the world. As a healthcare lead, I contacted the CEO of the Zepeto and Snow, and the immediate response was that they tried to stay away from me. The reason was most of these users of the 300 million, the 3억 명이죠. Users are mostly school children, mostly under the age of 15 or under, very young children. So healthcare, as we know, is more elderly. So the Mr. Kim, our CEO, said, we don't want you to be involved in our community because you make our community very old. So this is a status in our company about the Zepeto Metaverse, but AR and VR, but we do have the technologies. And I'd like to share what our vision is about the AR, VR, some of the companies that we think is very interesting. So at Naver, and I was very impressed about the previous session, how the experts in Metaverse views the healthcare industry. We view the same way. We view as a slide exhibited. #1 is the AR, VR, Metaverse. I think it's very important. Second is the digital medicine, the apps, how we promote wellness. #3 is the total healthcare, which means that the healthcare does not perform within the confines of this beautiful hospital like Bundang Seoul National, but it should be extended the full life cycle. And #4, as mentioned in the previous session, interoperability is very important. I think that I'm very happy to be at the birthplace of the best EHR in the world, the best care made by the Easy Care Tech. And then #5 is the solutions we developed at Naver recently, how to make our physicians' job easier, to reduce endless repeating questions, endless repeating documentation, how to process a stack of medical information. I do believe the physicians and surgeons do not have problem with lack of data. Rather, our problem is we have too much data. And we are sometimes ignoring some of the key issues and information provided by the patients or the apps or the notes. So how to integrate these data sets is very important for us. But today, I would like to speak about the AR, VR, the Metaverse section, how we think the most advanced companies in the world is faring this issue. So I'd like to share a few company strategies. So I think the how to do in education, surgery was discussed. But I think as an example, the NVIDIA is the most standout company. As we know, they make the servers called the GPUs. Those of you who understand the cryptocurrency, this is the most well-used servers for the games and cryptocurrencies and video games. And obviously, they like to use their more computing power based upon their servers. That's why they build this large computational sets and visualization and the hybrid cloud, real-time software designed and manageable healthcare information upon their server systems. #2, I think I already talked about a few times. I visited Intuitive Surgical, I think 3 times recently, about recent 9 months. Obviously, this is a computer platform. So everything, the technology is there for the remote surgery, telepresence surgery. So how to do a augmented reality surgery is an issue. As a company, obviously the issues of the proctorships, education is well addressed. Another big issue they're discussing is how to optimize the usage of these Da Vinci robot placed in all over the world, more than 6,000 of them. For example, some areas are heavily used, like here in the Bundang National Hospital, but some hospitals is not actively used. Maybe you can use a remote telepresence function of this robot and add it by the AR, VR, and so that you can maximize the hospital's capacity. If you're especially working in a nationalized system like UK, this may be a, how to optimize your medical utilization. Second is the most talked about the mental health aspect. So these is the contents to relieve chronic pain. So once you detect the chronic pain in various wearables, you can use dynamic breathing, pain traction, mindful escapes, and relaxation modes. So you can do a coordination of a relaxation using these VR technologies. Another thing I think is that for the mental health is a very integral is this the post-traumatic syndromes. We all remember the movies about the Vietnam, like Rambo's or Platoon. So these are the most closest thing to revive their painful memories rather than being in Vietnam again. So you can get over to this painful episodes using Metaverse and AR and VR technology. And another thing is that you can use this way. You can have your digital twin, let's say your DNA profiles is stored. So you can have a digital store of a pharmaceutical drugs, and you can choose and recommend, let's say you have a specific DNA type so that you cannot take aspirin or Tylenol. Then you can, these computer programs can relate and identify any side effects or what is the most efficient drug you can take depending upon your DNA profiles. But this is very interesting because they use a metaverse or AR, VR, the environment to offer these solutions. So this is based in the United States, founded by Dr. Yoon, the twin brothers who are Korean Americans. So we look forward to see how these nice innovative solutions fares in the future. Lastly, I think we do agree radiology is a big issue. So how to maneuver in this very tight spaces of the cerebral arteries and veins and doing an overlay of the surgical cases is always important. So I think I just have given you a very, very brief overview of the company, how we look at the metaverse, how we look at the digital health space. And I really congratulate the effort by the International Healthcare Metaverse Consortium to explore this exciting world of the future of medicine, which is Metaverse. Thank you very much.
Thank you very much. Thank you very much. The small change in the session. So the next presenter will be Singun Kim from LG CNS. LG CNS is a company that provides comprehensive consulting, system construction, and operation services at home and abroad, based on the expertise gained from years of success in large-scale IT products. Singun, please.
Thank you for your introduction. This is Albert Kim from Albert Kim, an Alliance Manager from LG CNS. As an Alliance Manager, I contact companies in which we might have mutually beneficial relationship. Metaverse is one of the areas I have worked on, and it is my honor to present our case in this webinar. So you might have heard of LG, but not of LG CNS. So I will introduce my company briefly, and then I will go over our Metaverse business overview. Before explaining about LG CNS, it is better for me to explain about LG first. Most of you probably might have heard of or seen in electronic shops, LG TV, LG refrigerator, or LG laundry machine. But actually, LG contains many subgroups or subsidiaries. There are three categories LG mainly focuses on: electronics, chemicals, telecommunication, and services. LG Electronics takes care of every electrical devices that I just mentioned. And LG CNS is in a field of telecommunication and services. You might wonder what CNS stands for. CNS is abbreviation for consulting and services. Here's a brief overview of LG CNS. Our headquarters is located in Seoul, South Korea, and we have more than 6,900 employees. Our operating profits keep increasing every year, and there are many overseas branches or branch offices around more than 15 countries. Our vision is to become a digital innovation enabler for customers. After COVID-19 lockdowns, many companies accelerate their digital transformation by adopting cloud or new technologies. By understanding their needs, we offer the customized products for our clients. Those are our services and products. LG CNS focuses on both public and private sector. And then this is our main topic, which is Metaverse business. The key strengths of successful Metaverse business relies on experts' capabilities, such as planning business scenario, actual development of design scenario, and operations or maintenance. Because LG CNS have these experts, we can provide a successful pathway for Metaverse business. Key capabilities that oversee the overall Metaverse business can be listed as a step-by-step approach to the successful business strategy and plan, service ideation, service development, and operation maintenance. Some key technical capabilities are listed below. Among those last two components are what we distinguish ourselves from our companies. Our competitors can do the first 4 components, but not all companies can do the last 2 components. LG CNS can connect the legacy system with new Metaverse environment, and we can add on more values by connecting with legacy systems. Services such as AI or big data can be offered to our customers. There are 3 typical business approaches adopted by Metaverse companies. The first case is the advertisement and marketing purpose. By using existing game platforms, companies can do their advertisements on their platforms. The second case is creating an event or virtual workspace for a team. Some companies provide built-in platforms where customers can use them for virtual workspaces, such as virtual meetings, events, and lectures. The Zoom platform is the example of this. However, it is more of buying license to use, so it is far from customization. The last case is the virtual service or space for enterprise. It compensates the weakness of the second case by enabling customers to customize their needs. By integrating clients' legacy systems with new Metaverse platform, it can add new values. LG CNS is aiming for the third type of business by providing 2 options: pre-built solution and platforms with customizable services. Our strength is our flexibility to respond with customers' needs. Now I will show some actual examples we built for customers. LG CNS provides virtual studio where users can interact, and the platform integrates customers' legacy systems, as I mentioned. This is an example of virtual workspace. Virtual meetings, chats, file sharing, and user info integrations are all possible because we integrate user info, personal business email, planner, and other company-related information. Employees can do their daily works in this workplace. Lastly, different virtual platforms for different needs are shown here: meeting room, Metaverse town, contact center, and exhibition, open space. Yeah, this is all, and thank you. Thank you for your attention.
Thank you. Next is Andros Lee from Singtel NCS. Andros Lee is a senior lead consultant at NCS Group Pre-Sales and the solution architect at NCS Group Partner Solutions Singapore. Andros, please.
Thank you, Dr. Elise. Yes, hi. Once again, my name is Andros. I'm here to present to you on the reimagination of healthcare in the Metaverse space. So what we're going to do is actually run through what our point of view is on the Metaverse space for healthcare, especially in the social experience portion. Now, why we feel that in the last 2 or 3 years, there's been a lot of traction gaining for a lot of our different customers adopting into the metaverse space is there are 4 factors. Especially after COVID, we found that a lot of our customers are actually had a mindset change to basically adopt working in digital space, in the metaverse space. And we also know that in the coming months, Apple would be releasing the imminent release of their AR glasses, which we would feel would push the adoption into the positive area where more people will want to explore this area. And also, when we look at the relevant technologies supporting metaverse, the AR, VR, MR, the infrastructure, the computer game technologies, we also note that they are actually reaching very high maturity levels. And this actually avails a lot of different technologies for our customers to actually explore and basically implement and test out a lot of different things. And third, we also note that there is a mindset change, especially after COVID. In a recent survey of about 7,000 employees, we have found that actually there are about more than 70% of them are actually willing to start exploring working in a metaverse space. So it's either the yes, the maybes, and the neutrals are actually more likely to actually work in the metaverse space now after COVID itself. Then the other trend we also notice, and for retail, is also because more people are spending time in the metaverse space itself. It actually motivates retailers to actually rethink about what channels of sales that they want to go through. So it's no longer going through your normal mobile application to do your orders, but actually exploring how you can actually sell your services and products in the metaverse space. Now, because more and more people are spending time in the metaverse space, your consumers could be attracted to stay in that area by offering them the typical resources, or rather the assets to dress their avatars up. So that also brings about the sale of digital goods. So it could be like accessories, it could be your NFTs in this particular space. Now, how NCS views the metaverse is that it's actually based on these key technologies. A lot of you may be familiar with the term cloud, blockchain, AI, hardware, all this, but we view that there are actually 4 areas that most of our consumers will actually interact with the metaverse space. One is through the metaverse platform. Simply put, all these platforms allow you to have a digital self to be represented in this virtual space, and you are able to interact with all the other various players doing different kinds of activities. It could be social, it could be for work, it could be to achieve an outcome through gameplay. Then the other areas that we looked at are also the immersive platforms. Now, immersive platforms are simply those platforms that enhance or change your perception of reality. So imagine if you are doing, I think earlier on in the first session, there was a lot of talk about using mixed reality to do surgeries. So those are very good examples of what immersive platforms are. Then we also talk about digital twin platforms. Traditionally, these platforms are not in the metaverse space, but today we are looking at a lot of providers creating digital twins of the buildings, giving you sensor information of how much energy you're using, where your lifts are. All these are being represented in a 3D format and allowing all the various stakeholders to step into the virtual reality of the building itself and be able to push buttons in virtual reality and creating an effect in the physical world, because the sensors and the physical world switches are all actually connected together. And this is one interesting usage of how Metaverse will affect on the digital twin platforms. And last but not least, of course, we have to talk about training. So a lot of what we have covered in the first session was all three very focused on how Metaverse can promote training. Okay, so what I'm going to cover through is actually focus on virtual spaces. Primarily, it will be for the healthcare workers as well as for the healthcare employees itself. And consumers. So how we look at it is that from the healthcare worker experience, we want to provide better engagement for the digital native workforce. So things like countering video meeting fatigue, enhancing team cohesiveness, removing time and geographical barriers. These are very common benefits that we already know. Now, coming to bringing about the new consumer engagement experience, we also wanted to be able to improve the experience that people go through when they are visiting a physical retail store, or if they are visiting the virtual store itself, and we're trying to bring the experience and make it more cohesive. And also trying to make use of the physical, the virtual space itself. We want to enable learning itself. Now, in the following slides, I'm going to show you some snippets on some of the use cases where we have actually talked with our different customers, and we found that it has actually gained quite a fair bit of traction. So, for example, as I was talking about, this is a virtual health hub where you can actually find a lot of different services that are actually provided, from medical services to retail. All these can be put in one virtual location so that you can actually allow your different consumers to walk through, decide what type of services they want, what type of health products that they want to purchase. And the other way of also using your virtual avatar together with video, you can also do preliminary diagnosis. So for example, if I'm doing traditional Chinese medicine, I could be asking my potential client to actually stick out your tongue. Let me take a look at the color of your tongue. Then maybe if it's a certain color, I could basically promote different types of health supplements to this particular customer. And because this is a virtual space, we are not limited by how big, how small, or the purpose even. So you could even use this as a space to conduct public healthcare forums, to talk about certain healthcare issues, to educate the public about certain health concerns, and all this can be done within the virtual space. And the great thing about having this virtual space is that it is actually very free flow. People don't have to register to sign up for the courses or listen to the forums. They can just walk in and out as and when they want. Now, on the flip side, we also want to talk about virtual spaces for the healthcare workers. So after the end of the shift or in between the breaks, we want to be able to provide them with a way to do self-reflection, to de-stress out. So one of the ways would be to, within the virtual space itself, provide mini games for them to play, where they can actually play with their colleagues to foster better cohesiveness or even teamwork. And another way of trying to promote self-improvement is to actually make available lunchtime learning fiestas. So this was a concept that we actually worked with some of our customers to create 30 minutes learning sessions so that people can just step into the metaverse, learn about certain topics. Then if they are interested, they can actually go for a more in-depth course itself. Then last but not least, I think both Naver and LGCNS also talked about it, which is actually to create that space for allowing people to do meetups, to talk about work, to talk about things that are not related to work. So this actually is an always-on platform that allows people to step in and out. So it's not like your traditional meetings where you have to create an appointment, then everybody can gather. But having a virtual space is an always-on environment that allows people to gather very informally. And I feel that this would be the way to go in the next coming 1 year or so. And with that, I would like to end my presentation. Thank you very much for your time.
Thank you, Andros. The next speaker is Stan LaRoque from Links. Sorry. Just give me a second. I lost. Okay. The next is the next is Mr. Wonjae Lee from Lotte Data Communication. Lotte Data Communication is a company that creates a smart world by combining advanced technologies such as AI, big data, IoT, and cloud-based IT know-how and technology of all industries such as distribution, manufacturing, logistics, finance, and healthcare. Wonjae, please.
Hello everyone, I'm Wonjae Lee, who is in charge of Metaverse business in Lotte Data Communication Company. Firstly, thank you for giving me time to introduce Lotte Metaverse in this forum. I hope all of you great time to understand what the metaverse is and how it is development and is going to change our life. Nowadays, we have experienced metaverse content in various industries, such as forum, shopping, entertainment, medical, healthcare, and education. Actually, we can say we are living in the era of metaverse flood. So, what is a metaverse? Metaverse is compound of meta meaning virtual and universe. In other words, it refers to a 3D virtual world that coexists society, economy, and culture like real world. Four categories are we can call metaverse. Augmented reality are already familiar because of Pokemon Go. Live logging is recorded our life in SNS, such as Facebook, Instagram, and so on. The representative of real world is navigation, which has used every day in our life. Lastly, totally digitalized world is virtual world that is different from reality. From now, I want to share my ideas regarding stage of development about metaverse and to inform where Lotte will be positioned in metaverse business. I think currently major metaverse platforms are focused on community, PR, games, which are weakly connected real business world. Those are mainly connected on marketing areas. Lotte wants to be positioned in strongly connected to real business world. Even metaverse world, people need to feel that object and human look like almost same quality in real. If there are not sense of reality, customers will not have interest in purchasing product, visiting exhibition, and enjoying concert. As you can see diagram, some metaverse platform provide strongly connected to reality and weakly connected to virtual. The others are opposite. As I told you, Lotte want to be positioned in strongly connected to reality and virtual sector. To achieve our goal, we will continually provide hyper-reality contents and combine economic activities of reality and virtual. Users can experience several services and activities in one platforms with various reality contents. To build hyper-reality VR metaverse platform, Lotte broadly have 6 core technologies. We have global top-tier VR shooting and graphic composition, along with real-time rendering, which can make no digits. Even through viewpoint have changed while wearing VR HM. In addition, we have patent then user can interact with the object in VR by eyes, chat, and touch. Furthermore, reality VR contents are normally high capacity, but we can dramatically reduce content capacity to run efficiently in VR HMD. Lastly, we have one viewer, which can optimize both digital object and real object in VR world. From now on, I'll show you short video that is demonstrated in CES 2022 in January this year. You can see that luxury house which you want to live in. It looks like a real house. Next, you can see the new type of shopping experience by personal shopping advice. It is combined real person and virtual environment. The virtual fitting room, users can select the clothes, shoes, a bag, what they want, and can check how it looks like as digital human put on instead. Lastly, you can enjoy virtual K-pop concert. No matter where you are, you feel that you are in concert hall and celebrities are in front of you. I think a metaverse service based on hyper-reality contents can be applicable in various industries. Currently, medical and healthcare industry uses metaverse, such as diagnosis and describe surgery for patients, and providing information and training for students. I think hyper-reality content can be widely used in medical and healthcare. Beyond Metaverse 1, which was unrealistic and separated virtual and reality, we are in Metaverse 2, which is hyper-reality and weakly connected to virtual and reality. In Metaverse 3, we will live strongly connected to virtual and reality with super sensible. Thank you for inviting and giving me your time to share Lotte Metaverse. I hope you have continually interest in Lotte Metaverse. Thank you again and have a great time.
Thank you very much. Next, we are moving on to listen to Ultraleap's presentation. Ultraleap is the company that developed the VR hand tracker, Ultraleap Motion, and has the world's best hand tracking and haptic technology.
All right. Thank you. My name is Sean Robinson, and I'm the Director of Business Development at Ultraleap. So I appreciate the time that you guys are providing us. And I'm going to spend a few minutes here talking about the benefits of hand tracking in healthcare, and particularly what we have seen from our customers in this space. So a little bit about who we are and what we do. First, basically what we are seeing increasingly, anytime that you are looking at a VR device these days, you're seeing a trend of more and more cameras and optics that are being placed upon these devices. And this covers the gamut of everything from positional tracking through SLAM to augmented reality pass-through for an increasing branch of MR devices, such as the Lynx headset that we have here. And then dedicated cameras for hand tracking, as well as eye tracking and facial gesture or facial recognition. We're a small piece of that. We are one part of the Lynx suite for hand tracking. From that, you can capture data basically through two infrared cameras on where your hands are, their orientation and velocity. So what? What do you want to do with that? Just grabbing a hand position in space is actually relatively easy. There is some almost free technology that you can get out there to start doing that, and some very basic positioning that you can do, say with Clay Air that Nreal uses. But what we provide is not just hand positional data, but how to incorporate that through our interaction engine to make it seem relatively easy and seamless with our physics engine on interacting with interactive objects. So like what we have here is the idea of what a launcher screen could be like from the HMD without using any controllers. So fundamentally, that gets to what we want to do in VR, is interact without something that's abstracting our hand in VR, so we can do what we always kind of thought we could do with our superpowers in the VR space, or training like we actually train in reality. Where we're seeing hand tracking getting some pull from those content developers and end customers and end users in healthcare, I think has been well covered by a variety of other presentations previously in this symposium. But a few that I would like to spend some attention to, because they have gotten not as much attention, but is empathy and wellness. We have a lot of developers in our community that are really attempting to do this. So somebody touched on it before a little bit about kind of the BLM aspect in the United States, but even from health practitioners, there's a group that I'll touch on a little later that focuses on for doctors and healthcare practitioners to know what it's like to have the various maladies that they are attempting to treat. So kind of getting things from a patient's perspective, but also a variety of not just surgical applications, but physical therapy. So we're seeing groups like MindMaze, Penumbra, that are starting to look at hand tracking and what they can do from a physical therapy standpoint, particularly for patients that are recovering from a stroke. But the vast majority that has been touched on has been simulation and training. The reason why it's getting a pull is fundamentally because it works. We have talked a lot about here about the retention that users and learners get from virtual reality. That retention of learning, it's not just showing that, yes, you can pass that safety exam, your employees are capable of operating a fire extinguisher, but remembering identifying a fire post that training is where it actually has any value. And so because very large corporations, and for me personally, I deal with very large retailers in the United States that are doing a lot of this pull in the training space, and fundamentally that ROI is very valuable to them, and they see it, and that's why they're pumping a lot of money into the space. But just because they're training, what does that have to do with hand tracking? And what do we do? I think Natalie Garrett from the Northern Carolina, she was talking about that. You don't just want to replace something with something more expensive. One of the basic reasons why you want to do this is eliminating that first barrier to entry for a lot of people. I think Dr. Ahmed talked about the cassette player, and some people being a little older that might recognize that. This translates to new users coming into VR that don't know how to use the controllers. In fact, if I were to say press the Y button in order to select the engine component that you want to break apart, or to select the patient anatomy that you want to look at, a lot of people would be confused and not know where that Y button is and which controller they should be doing. So what happens from an ROI perspective is new users are having to waste a lot of time not focusing on what they're training from a healthcare perspective, but they're just learning VR. They're learning how to use the controller. And so when you are a very large group and you have a good number of users that are going through that, any time that you were spent wasting on the controller aspect is significant loss as far as the applicability of this as a training module versus something that's 2D or in person. The other aspect, and once again, giving Lynx a little bit of love here as they're one of our customers, is that as we see augmented reality and mixed reality, which is fully functioning in the real world instead of creating a completely virtual world, that's things like Pico and Barrio are doing. You are not going to want to hold controllers while you're trying to show a task in the real world. So in this case, it's replacing a server rack. That server rack has been identified within AR and has information around it. Nonetheless, you can't select that information with a controller because it'd be cumbersome to set that down, pick it up, set it down. You need to have a fully functioning UX from just with your bare hands if you're going to have some type of augmented reality pass through from the real world into your HMD. So what are the other benefits and how the hand tracking play with this? The biggest one that we see is not just a lot of customers demanding real life situations. In fact, from aviation standpoint, Europe, I believe Germany does not allow controllers legally to be in any type of flight training because they want everything to be muscle memory and reality based. But one of the biggest things is time to mistakes. So we've heard about a challenge with CPR, and whenever you're providing that type of learning to a student, the time from which the learner makes a mistake to the time that you provide that correction is critical for them to learn from that mistake. So actually having their hands in it, and they can look at the placement of those hands, say what they're doing CPR or some other tasks, you can have the application, or the developer can provide the application to correct the student immediately, and thus dramatically improving the value and the retention of that learner for the learner. But also one of the just most basic logistics, and one of the things that allows us to get picked up by customers, is simply reduce costs for the controllers. Charging controllers is a pain. It's a logistics hurdle. You have batteries, you have to make sure that they're charged, and they get lost and they get broken. It's really easy to have 2 infrared cameras that are attached to a headset or already integrated. And from that, we kind of prove our ROI just on a logistics basis. Say if you're Walmart and you have 100,000 HMDs. So a few of our partners that we're currently working with that are using us in some of their applications. First one, Tetra Signum, and that's how we came to this conference to begin with, doing a CPR training application. We also have Embodied Labs, which I discussed a little bit earlier, that is focused on empathy and wellness. In this case, they are very much focused with Alzheimer's, what it's like to have Alzheimer's, and giving you a visual and physical feedback of what it's like to have it. And then various other maladies, and that's what their portfolio is attempting to expand on. And for them, the whole point is the immersion. So when you abstract any component of yourself via a controller or something else within your avatar, that distances yourself from the immersion into the disease. So for them, from the beginning, they didn't want any controllers and have continued to use us as their primary input. Another group out of Los Angeles is Zenko. They're doing a variety of holographic surgery planning on a looking glass factory device and using an LMC for that input. And so why are people starting to choose us? Another partner that will be coming down the pipe this summer is the Globus and the Excelsius system. And the reason why they choose us is because of our exceedingly fast initialization. We basically, as soon as you put your hands into the field of view, you want to see them. If there's any kind of time or lag that happens from seeing those hands, you kind of broke the immersion of VR and remind yourself you're not really there. So we need to be fast. We need to be mature. People need help. When developers start using this, they need forums, they need assistance beginning that process. And we've been at it as our iteration as Leap Motion for over 10 years now. And can provide a lot of assistance in that regard. And then finally, we are completely platform agnostic. You don't have to go through Meta's new accounts or Facebook accounts or Oculus accounts, whatever they want to masquerade it as right now. You can use it on any device, and especially anything that is on the current Gen XR2 chipset from Qualcomm. So what does world-class mean as far as hand tracking? Why is it the best? And these are the primary metrics we believe that hand tracking should be measured by, is reliability, speed, and accuracy. Reliability with hand tracking, basically the hands are there and they stay there the way that you're intending. So one of the biggest tests you can do is putting 2 hands in front of each other. A lot of times with any type of computer vision device, when you put one hand in front of the other, it can't see the other hand, so the other hand drops. It needs to be able to function in the dark. It needs to be able to function in the light. And that's why all very high-end enterprise VR, AR will use some type of active illumination, some type of flashing from an infrared perspective that you can see in very bright light conditions or dark. You also need to see all types of hands. And this is more of a problem with RGB cameras or a lot of consumer devices that want to be cheap and use much cheaper cameras. From a power perspective, sometimes they have issues picking up everyone. The great thing about infrared is that all skin looks the same in infrared, particularly ours in our spectrum. So we have no problem as far as inclusivity. And then also a lot of times you have cluttered backgrounds. It's not a sterile environment for everybody. And so we've had a lot of work in the LBE space where there's lots of people moving around, running around and kind of be arcades and stuff like that. And we need to work the entire time. That's a lot of experience in that. Speed, which I already touched on, we're running out of time, so I'll move a little quickly. And finally, accuracy. And accuracy becomes way more important when you move from the VR space to the AR space, primarily because you can see the hand. So when you go to grab an object, if your hand isn't accurate and you touch the object, you can't cheat a little bit like you can in VR to some extent. And so that is why some of the soon to be released high-end mixed reality headsets are using us for their hand tracking versus say Clay Air or other options. We're really kind of agnostic with how you use us. We have Unity, Unreal plugins, and we are also a founding member of the Kronos group, which is responsible for OpenXR, a common standard for XR technologies, particularly for hand tracking inputs. Plenty of guides that you can get started. I'll have some contact information at the end of this, and I'll be glad to assist anybody in getting started. If you wish to start now, we have a variety of distributors that can attach our hardware, install our software onto a Pico Neo 3, and you can get started immediately. And please contact me, and I'll be glad to get you started and follow up with any other information that you may require from us. Thank you.
Sean, thank you very much for sharing your expertise. That was Sean from Ultraleap. In the interest of time, we will sacrifice the coffee break. That was very democratic of me. Yeah. Okay, let's carry on. Okay, so the next speaker is Mike Dowding from Tetrasignum. Tetrasignum is a company that aims to innovate global medical technology and education by gathering top medical professionals, experts, AI, and big data experts. The first product of Tetrasignum, CBS 2.0, is an XR-based CPR training solution that is used in various institutions in Korea. Mike, please.
Hi, everyone. I'll try to make this quick, and thank you all for coming today. So today I would like to introduce you all to Tetrasignum. As mentioned, an XR-based solutions company aiming to innovate healthcare one project at a time. Like any company, if you wish to succeed, your mission must be clear and your goals must be achievable, or at least you should believe they are. We believe that we can make people's lives healthier through the creation and implementation of extended reality technology. Inefficiencies are inherent. There are always a better way of doing something, or at least someone will think there's a better way. Our better way is to focus on medical education, prevention, diagnosis, and digital therapeutics. An invention is generally defined as creating something new, whereas innovation is taking that invention and bringing it to the masses. We want to do both. To innovate healthcare, we want to develop cutting-edge technology in partnership with global leading medical professionals and big data experts. Strong leadership and a powerful network will always be important for change. Founded by Dr. Sang-Hoon Chung, the president of the Asian Society for Cardiovascular and Thoracic Surgery and the former CEO of Seoul National University Bundang Hospital, Tetrasignum is built for change. His network, or should I say friends, are global leading experts from all around the world that share a similar mindset: innovate and make people's lives healthier. You could say it all started with CPR education. This was one of the first solutions developed by Tetrasignum, which you may recognize from earlier presentations. Everyone should know how to save a life, and everyone deserves the same education. Now you've all heard about it, so let's show you exactly what's going on. This was CBS 2.0 and was developed with an HTC Vive headset, Ultraleap hand tracking, and immersive VR. The idea was that taking a mannequin, embedded sensors, and having an AI instructor would equal the playing field. Everyone would have the same chance to educate and get the same training. Typically, in places like the US, The Red Cross will train a teacher will train students. So education can vary greatly. But with this solution, everyone gets the same chance, everyone gets the same opportunity, and everyone can do it exactly right. So this project was very important and kind of sparked everything that's happening here today. Nursing education is another big one for us. Led by Dr. Park and Dr. Suh from Seoul National University College of Nursing, Tetra Signum is currently collaborating to develop interactive content centered around basic nursing skills. As we all know, there's a shortage of skilled nursing professionals, and we want to help educate the future. Chemotherapy and dialysis patients go through a lot of stress. Sitting in the chair, staring at tubes can really amplify that stress. Starting last year, we initiated trials with very supportive hospital staff at NSUBH to try and alleviate some of that stress by putting patients in fantasy places to help a 360 video. And finally, mental health should never be taken for granted, and isolation for an aging population is never a good thing. Although we are still in early stages, we believe that the right technology mixed with the right people can combat these issues. Today's presentation wasn't to serve as a simple company introduction. Our aim is to partner and collaborate with as many like-minded individuals and institutions as possible. So please feel free to reach out and let's explore how we can support each other and work together to innovate healthcare. Thank you.
Thank you, Mike. Thank you very much. The next speaker is Ramesh Raja from DigiWrite. DigiWrite is a mobile web application and MEP development company headquartered in Manchester. Raja, please.
Thanks for the introduction. So basically, DigiWrite is a Manchester-based technology company. So we are currently serving larger medical companies, real estate companies, tech, and fintech as well. When we have collective experience in a lot of domains, and one of our founding members have 25 years of surgical experience from National Health Service, England. So we have our business model is we have all the front-end data production, account management, GDPR compliances, all in Manchester. And we do have a development center in India where we are supporting larger enterprises with their digital transformation initiatives and immersive adoption initiative as well. So we are currently, when it comes to healthcare, we are currently working in 3 domains. One is medical legal, where some of the US-based we are helping some of the US-based lawyers with, visual representation using immersive technologies to help, judges in England and as well as the judges in US to take a decision on the verdict of the case in medical legal. And secondly, multidisciplinary team is something which we are working on. And we are working on some amazing intervention radiology-based contents as well. So, and we are supporting our clients in basically 3 pillars. One is, the first pillar is the patient touch points, building some applications, AI, VI, blockchain based applications and immersive applications with the patient interactions. And second pillar is improving the healthcare institutions operations efficiency using robotic process automation combined with immersive technologies. And third is helping healthcare institutes worldwide to innovate using all this industry 4.0 technologies. So, and apart from the healthcare, we do work with climate change, sustainability as well, and the education contents in immersive technologies and other domains apart from the healthcare as well. And we have around 20 years of collective experience in healthcare and life science from England as well as in India, supporting larger corporations and life science corporations and pharmaceutical institutions in Western world. So Here I'm just trying to show you some of the examples of the content which we produced. So, which you can see here. So it's in a dental setup. And I'll quickly shuffle between different contents.
Welcome to neonatal resuscitation protocol. Take cloth and clean the baby. Need to stimulate for breathing. Use left hand to turn back the baby.
The carotid pulse. There is no pulse.
Begin CPR.
Starting CPR.
Take the stethoscope and be ready to auscultate the chest. This is the ACLS virtual reality simulation.
So these are some of the content which we produced, and our main capabilities are in immersive technologies, blockchain, machine learning, computer vision, and cloud native solutions. Basically, Industry 4.0 revolution. We just want to be a pioneer in the Industry 4.0 revolution, and we have improved capabilities in digital healthcare as well. So how we are helping our clients with all these three pillars, and with our expertise in blockchain, immersive, and machine learning is, there are India has a massive resources. There were around 135 million technical resources available in India. So our main aim is we are working with top 5% of the Indian developers and immersive developers and AI and machine learning developers, and connecting them with the Western world currently to help some of the institutions to meet their delivery goals, to be more agile and unlock the potential to scale unlimited and produce more content, more applications, improve the speed as well as the precision. So how we help them is, the first is we do a team augmentation, where if you can let us know what are the delivery challenges you have, we will do the consultation on with our expertise what we have, and we supply you the resources, and we'll also manage the outcome. That is team augmentation. And second kind of service, how we can help you is, we can set up a offshore dedicated development center for any produce any VR content, AR content, any immersive contents, as well as utilizing our software development on cloud native solutions and blockchain and machine learning solutions, and use our expertise to set up a premium offshore agile team to meet your delivery goals. And third kind of service is just a product development. We do it on project based. If you have any deliverables, if you share the requirement, we can able to deliver that with our internal resources. So this is about Digiride. So it's no matter which pillar you are in, we are happy to use our expertise and set up a premium offshore agile team for you to meet all your immersive based delivery goals. Thank you.
Thank you, Ramesh, for your presentation. The next speaker will be from Virtually. Virtually is the company that is the next generation AI avatar digital assistant that combines market-leading response speed and accuracy with the world-leading patented hyper-realistic avatar interface. I suppose somebody else is replacing Alan.
That would be me. Hello everyone. This is Satish Pandi. I'm from Vittori. So Vittori, we are a company based in the UK, and we are a next generation clinical informatics avatar company. we combine machine learning technologies as well as avatar technologies to create an experience for users to actually learn, educate, and understand and retain the information better, basically. So Vittery is currently used in various different industries, starting from healthcare. We have deployments in some of the surgeries here. We have deployed it in large pharma companies and also some of the leading healthcare insurers. So what does the problem that Vittery actually addresses? So Vittery addresses the problem of poor healthcare education. It addresses poor health patient engagement, comprehension, and also the more critical information is how people actually understand information and retain them and use it later. And this is actually associated with poor outcomes and elevated mortality and rising costs. So some of the features of Vittery are, we can provide services in 60 plus languages. We can do text to speech, simple integration, multi-ethnicity avatar, and also, we have a machine learning component which actually can understand user inputs in their natural way, and then provide answers in a digital format in an avatar. So I'll give you a simple example of the use case here. This is a text-to-speech use case. So you can see we created this for one of the companies where to provide consent information. So here someone is going to take part in a cataract surgery, and you can see we're using an avatar to provide the same digital information in which was previously on a textual form in an avatar format here. Oops. So we can see, we can actually do the same consent in multiple languages, and we can do that at scale. And here is another example where users are actually typing in a question and getting an answer back.
We're not seeming to get the audio. Are you able to enable the audio?
Oh, right. Okay.
I think it's on the bottom right, Satish, on the volume bar. Yeah, just highlight the volume bar there on the right. See, to the right.
On the right there.
Keep going right.
Yeah.
Keep going right. See the volume bar at the end.
I can't see it, Cade.
Just hover over that banner again. The play bar. Hover over play bar.
Okay. Oh yeah.
And a weaker immune system. Preparing for chemotherapy in the right way can help you manage this treatment and deal with its challenges.
La chimiothérapie détruit les cellules cancéreuses, mais elle tue également les cellules saines, provoquant des effets secondaires tels que la perte de cheveux et un système immunitaire plus faible. Une bonne préparation à la chimiothérapie peut vous aider à gérer ce traitement et à relever ces défis.
वयस्क कैंसर रोगियों की विशिष्ट शारीरिक स्वास्थ्य आवश्यकताएं होती हैं, लेकिन उनकी अद्वितीय भावनात्मक और
So you all get an understanding of what our technology is. So we are providing an avatar technology which will actually present information in a very hyper realistic form, basically. So I was just thinking, how we can use this in Metaverse. How Vittery can actually sit in Metaverse. So I think lots of presentation we have seen that all the things that they're saying is, people are going to collaborate in Metaverse. It could be for health, it could be for anything else. But here, Vituri, what Vituri can do is actually, you can see here a little collaborative environment where people are actually speaking in their own language, and we have a real-time translation engine which will actually translate everything, and it will actually translate to the relevant language that the user have selected, and they will hear in their own language. So, for an example, someone speaking in Korean will actually hear back, will get their audio translated real time, and it will be translated to one of these languages or 60 plus languages we have, and whenever another person is speaking in their own language, will get their audio translated back into Korean to a person who just understands Korean. So this will actually elevate how people are collaborating. This is much more of democratizing the language barrier or breaking the language barrier here. And the avatars here will not be any sort of an animated avatar. It will be our own hyper-realistic avatar. So it could be our own avatar. We could turn anyone into an avatar in less than 5 days. This will be like you yourself in the metaverse environment, speaking in different language to various different people. It could be for actually an office presentation that you're currently doing, or it could be a collaborative designing something or learning about something. We can all do that in our own language with our own face and everything. It's hyperrealism. So the next thing I have is how we can use Vituri in metaverses. Like, for an example, a doctor is doing a surgery, or a team of doctors are doing a surgery in one part of the world, and someone is actually learning about how people are doing a surgery. They can actually use Avatar, and what they can do is Vituri technology, and ask questions about, in real time as to, what procedure is this, how are you holding the scalpel, or, you can ask question and get back an answer in the real time. So it's basically an enhanced form of learning, and Vituri would allow that. We have capabilities to do that. So those are the things that I really want to present today. Thanks very much for your time. And these are our contact details. If you have any questions, please contact us here. Thank you.
Thank you, Satish, for this good presentation. So next will be Mike, you're back. This is Mike Dowding from Grid. Grid is an XR-related company that developed the Metaverse platform, Moin. Mike, go away.
Hi, everybody. So let me start by saying it's an honor and privilege to be able to present to you all today. And at the same time, I would like to say it's very exciting to have the eyes and the ears of so many supportive people regarding the metaverse. Sometimes a bad thing can lead to a good thing, and Moan was just that. Initially developed in a response to combat the aftermath effects of COVID, the platform quickly became a leading Korean go-to solution for education, seminars, and conferences. This quick adoption could be attributed to our primary focus on user experience, interaction, and accessibility. But this was a beta version that we treated as a great learning experience. The alpha version looks like this. We paid a lot of attention to the UX UI design. People like easy, and easy is what we try to accomplish. Starting with our event listing and event sign up, we try to make it as painless as possible for individuals to search and join events of interest. Next, it came to appearance and the avatar that best represents you. Even in a digital world, we can quickly realize people really care about how they look. So we made sure to offer a wide selection of choices. And finally, high quality controls and tools for interaction. As you can see from the captures, we put a lot of attention into these details. Dress for success or the mood you're feeling. You can choose from numerous combinations to meet the desired look that best suits you and your personality. Be who you want to be, but never had the chance. Cloud-based is super important these days and seems to be a necessary feature for driving innovation. Also, It unlocks what is possible or what a user is capable of doing in a digital space. Video streaming, 2D or 360, to put people in operating theater. 3D XR, VoIP chatting to give users a feeling of realism. PDF presentations, class as usual. 3D model assets for greater detail, and so much more. Currently, we can support up to 200 concurrent at one time. Meeting rooms allow users to interact in small or large groups for reviewing important and private issues, like a medical procedure. Our classrooms are capable of recording attendance data, controlling user seating, and support multiple presenters at any given time. We designed our conference rooms to cater to large audiences. This is a solution ideal for societies or big firms that are limited by time and wish to meet more often. And our children's rooms, which could make that stay at a hospital a little more enjoyable, whether it's watching movies with friends or hanging out with your family, a virtual environment can sometimes be more enjoyable than reality. These are just a few examples of how we see MOEM being used in the future. If you think about it, the possibilities are endless and borders don't matter. The metaverse is a global gateway that is meant to connect people for the greater good. Thank you.
You actually sound like an avatar, right? Okay, all right. So the next speaker will be, now we're going to listen to VR Evo's presentation. VR Evo is a metaverse-related company that provides virtual reality and video games, virtual reality and 360-degree service. Please.
Hi, everybody. My name is Jeremy Carter from VR Evo. Thank you to everybody for attending today and to the organisers for putting on the conference. I'm joined today by my colleague, Dr. Tony Payton, who's one of the co-founders at VR Evo. You'll also see some new branding on here. So we're just changing VR Evo's morphing into Centira. And today we're going to talk to you a bit about using VR for the delivery of authentic simulation training. So as I've mentioned, so Centira is the new name for VR Evo. We're a UK-based virtual reality software company. We're a spin out from the University of Manchester, and what we do is produce psychologically authentic simulations, and we use AI-driven virtual patients with natural language processing, speech recognition technology sitting behind it. We're working in close collaboration at the moment with the University of Manchester, who are one of the leading UK universities, the #1 for research and innovation funding in 2021. And we have the benefit of the fact that they are the largest medical school in the UK and operate within the largest healthcare campus in Europe. And so that then puts them in a great position where they're actually leading on the exploration of using tools such as VR in the teaching and learning practice. So when we consider about using VR for teaching and learning, there's because there are a number of real benefits to that. So firstly, it being an active experience. So participants are really in the zone with that. Instead of just receiving information passively, they're actively engaged in the simulation itself. And that's because it invokes that sense of presence. And we know through many studies that this enhances engagement levels. And we do this through using realistic avatars, putting people in multi-user environments, using hand tracking, as Ultraleap was just talking about. And all of that combined helps aid learning retention. So it's a really powerful tool for teaching and learning. And so I think Tony's going to now just talk about the case study that we've been doing with the University of Manchester and why they've got involved in VR. So Tony, are you there?
Yeah, thanks, Jeremy. Hi, everyone. Before we actually started the company, we just wanted to make sure that staff and students at the university liked VR. So we set up a VR lab in the medical school, and we put through over 300 staff and students, giving each user about a 45-minute session in VR, typically using health-related off-the-shelf software, anatomy, molecular biology, imaging, that type of thing. And at the end of the session, we gave them a questionnaire that had about 24 questions on. I'll just give an example of 2 of the responses for those questions. So one question was, would VR enhance your learning experience? And it was overwhelmingly yes. So we only had 2 responses from 324 people who didn't think that VR would enhance their learning experience. And very important for a university, we asked the question, would you more likely enroll on a course that includes VR as a teaching tool? And again, it was overwhelmingly positive. So we saw that there was a massive amount of interest from both staff and students, but what we couldn't find was off-the-shelf software that we could stick straight into the curriculum. So you can go to the next slide, Jeremy. So we decided, so a colleague and myself decided to start a spin-out company. My colleague is Dr. Martin Fergie, who's an expert in AI. And we've been fairly successful in attracting a number of grants. The most recent grant that we've attracted is a £300,000 funding from Health Education England. And this is to create 5 scenarios: diabetes, mental health, cancer, urgent care, and respiratory. And what we want to do is to make these scenarios as realistic as possible. And one of the things that we're putting into this is something called natural language processing, so that the student can talk to the avatar and the avatar patient will talk back to the student as you would in real life. And we're also making this for multi-users. So at the moment, we can have up to 20 people in a scenario. And we're designing it using WebXR, so you can cross platforms. But in particular, we're focusing at the moment on the HTC Vive Focus 3, which is a lightweight standalone headset, similar to the Quest 2, but with a wider field of view. And we've just bought in 100 of these for the medical students to try from September. And we've also just started, really started developing these particular simulations, but we've just started the evaluation, including looking at how to build AI into the assessment and feedback. So Jeremy's going to show you a very short video now of the start of this work.
Great, thanks, Tony. And I guess just talking a little bit about the more about the why. So we were looking at obviously one of the biggest challenges in healthcare at the moment is misdiagnosis. And that's a huge challenge for the healthcare industry as a whole, and that has its roots. They're often found actually in poor sort of patient history taking and clinical reasoning, and that does stem from the current teaching and learning practices that are available to people. So that's one of the things that we're looking at addressing and actually having an authentic conversation with a patient, which is what we'll show you now. So look at that.
Hello, how can I help you today?
I have this horrible pain in my stomach. It's killing me. I've never felt anything like it.
Can you show me where the pain is?
Here is the worst part, but it's all over.
When did the pain start?
Just a few days ago. It starts just as a weird feeling in the belly, but it's getting worse and worse. When a bad wave of pain comes, I can't think about anything else.
Is there anything that you do that makes the pain better?
When I take some cocodamol tablets, I have it gets a bit better, but that only seems to last an hour or so. That's partly why I came to the hospital. I really need some strong pain.
Do you drink a lot?
I don't drink every night, if that's what you mean. When I do drink with my mates, I drink a lot. On the worst night, I probably drank a few bottles of beer, maybe a bottle of wine. I don't really remember, to be honest. Do you think I caused this by having too much to drink?
Yeah, I'm just going to give a patient examination. On a scale of 0 to 10, how much does this hurt?
Oh, that's really good.
Okay.
So yeah, hopefully that gives you an indication of the type of work that we're doing at the moment. So we're as Tony mentioned, we're building those simulations for use within the University of Manchester, and obviously in conversations with other institutions as well. Thank you very much for your time today, and we look forward to connecting with many of you as we move forward. Thank you.
Thank you. Our next speaker is Jingdi Zhao from DataMesh. DataMesh is an XR and AI related company established in Seattle in 2014 and is growing by expanding its business into the metaverse related fields. Jingdi, please.
Hi everyone, this is Jingdi from DataMesh. I'm so excited to be here to meet everyone in this Meta conference, and thanks to Health on Cloud to organize this impressive activity. Let me introduce myself firstly. My name is Jingdi Zhao. I'm from DataMesh. I'm based in Shanghai and responsible for overseas business development. Today, I would like to share something new, to re-image healthcare with XR. There are several challenges we meet today. How to let patients better understand the symptoms and accept treatment or advice in short time. How to deliver medical terms to patients who may not have professional medical background. How to generate a standard digital resource library that can be used for all age medical education. Especially during pandemic time, we all experience a lot, and we are looking for some new technology or new way to start change. DataMesh do have some solutions in applying XR technologies in healthcare. In that video in the right, you can see that is a lumbar disc hair narration introduction. We put lumbar disc model into DataMesh structure and create a 3D introduction of this symptom. Compared with the traditional 2D images, the 3D model can present spinal in a more intuitive way, especially for patients who may not have professional medical education background. By using XR and 3D holographic to clarify symptoms can help patients to know their body easily. At the same time, doctors are able to clarify symptoms more clearly. That also helps to avoid some misunderstanding. So this video here is taken from the HoloLens. By using HoloLens, you can even use your two hands. You can use your natural gestures to control, to interact with those holographic models. And beyond that, XR is 3D introductions. In these pictures, you can see how XR healthcare looks like. The doctor will use the iPad to play 3D symptom introductions, while the patients with HoloLens can see the holographic 3D model. Also, together with other remote meeting applications, we can realize remote clinic easily. We can get in touch with doctors who are based in other cities. AR glasses captures videos to remote doctor, and doctors use his laptop to join in this online clinic. So, How do we do this solution and quickly apply it in AR glasses like Microsoft HoloLens? We Data Mesh has a XR designer named Data Mesh Director. Data Mesh Director is a mixed reality content creation and rapid distribution tool based on Data Mesh digital twin platform, supporting CAD, BIM-like 3D models and also other medical models to generate XR content that supports real space mapping with one click. And the Data Mesh Director can be used for any spatial, temporal, and process-related digital twin content design, such as construction, process guidance, inspection and maintenance assistance, assembly training, and 3D instructions. And also we can use Data Mesh Director to design or edit a surgery process XR project. And in this video here is this, and also these XR projects is created by an orthopedist. He uses Data Mesh Director to demonstrate a orthopedic surgery process that can be used in pre-operative planning stage to help clarify how this operation will be done. So with this video, we can use it for our patient, and also we can use it for in our internal meeting, like several doctors or our new medical students. We can sit here and we can see how this operation or how this surgery will be done step by step. It is very clear and it's very intuitive to see. And you can download the Data Mesh 1, the XR viewer from Microsoft Store in HoloLens, and start your first XR trial very soon. If you have any questions or interest of our XR solutions, please feel free to contact us. Thank you.
Thank you very much. Next speaker is Andrea Selim from Codifactor. Andrea is a software engineer and co-founder and founder of Codifactor, a digital product development agency. As an experienced UX engineer and engineering leader, she is skilled in mentoring and coaching software engineering team, developing strategies and driving them. Andrea, please.
Thank you. Hello, everyone. First of all, thank you for the opportunity to be here. My name is Andrea, and my name is Andrea Chera, and I'm a founder of Codifactor. I'm having more than 20 years of experience in planning, producing, and delivering and managing top-tech digital applications, and also leading agile software engineering teams, as it was mentioned. Especially I enjoy creating and driving development strategies. So Codifactor is a boutique digital product development agency, and we are based in Manchester, United Kingdom. We are specializing in digital product development for your startup, project, or online business at any stage. Our vision is to work with you to support and provide all the skills and content you may need to grow. Whether you are starting your business or entering the growth phase, we are here to shape your ideas and convert it into reality and build your product and help you thrive. We run our project as a fully remote agency and have put in place an efficient, highly personalized processes that enables us to collaborate with our clients worldwide. It doesn't matter where you are in the world. We will adjust to the context of your location. We believe in a strong and long-lasting business relationships based on a mutual trust, goals, and values. Because of this, communication and transparency are integral parts of our work. We take full ownership and responsibility for every step of our project, be it customer research, UX design, app development, or even online marketing. We think of ourselves as a one-stop shop that is able to provide all the digital services for your business needs. We will research, design, build, market, and analyze your digital product, and also support your growth and scale with a lean approach. So we tried to define our services and divide it into 4 different categories. As the first category is a concept. It is actual discovery phase where we help to clarify the business model, scope the project, and minimize the development risks. During and after the discovery session, our team will produce a number of deliverables. The development process proposal, initial solution and architectural overview, detailed user flows diagrams, and the backlog with initial milestones and epics defined. Once you accept our proposal, we will start with our iterative product development process. Then the next stage will be design, unless you have already some artifacts, because good user experience design is crucial for the success of your product. So before we start any of the coding, it is necessary to provide a blueprint for the user interface. Unless you have these artifacts ready, during the development sprint, during the design sprint, we will perform user experience research, define the user personas, deliver style guides, wireframes, prototypes, and so on. And then, because producing these prototypes takes less time and is cheaper approach than creating a real code proof of concept, you can later use these for user testing, validation of your idea, or pitching. After the design sprint, we start our development process. Sorry, I didn't change the slide. Yes. So in the development phase, you as a product owner will be fully involved in the development process by prioritizing the product features and be aware of any missing requirements, blockers, and status of the project. At the core of our development process, we built in the agile principles, meaning that we will anticipate the need for flexibility, and we will apply a level of pragmatism to delivery of the finished product. And finally, once your business reaches the product market fit, so after releasing your product into production, and we will try to help you to search for this product market fit, once you're there, you will need to adapt. You will need to respond to the changes in the market, and you will need to handle variable loads. It means that you are stepping into the scaling and growth phase. So we are able also to support you here. With our experimentation mindset and our data analytics insight, we will be able to adjust your product in time to adapt to the market needs. So your satisfaction and success is really important to us. Our main goal is to discover, understand, and fulfill the needs of your customers, not our customers, yours. So it means that we always measure our success by your success. And I would like to thank you for this. I finished. If you would like to learn more I don't have the last slide from some reason. So thank you. And with my well, yes, if you would like to learn more, please reach out.
We've got all the
colleagues.
I'm just going to see. Okay. All right. I think thank you, everybody. And first of all, this is the conclusion. No more lectures from now on. Wonjae is going to talk.
Okay.
Wonjae is supposed to have one present. Yeah, there is. Yeah. There is, right? Yeah. Oh, I thought that was okay. I apologize. Dr. Wonjae is going to represent Health on Cloud. He is the host of the conference for 2022. Health on Cloud is a company which seeks to overcome healthcare disparity, provide the best healthcare for everyone by providing medical content and education services based on XR technology and professional expertise. Dr. Wonjae, please.
Thank you, Dr. Anis. This is really the last presentation today. So I'm Wonjae, I'm Chief Medical Lead for the Health on Cloud. So let me begin with our mission and vision, because that is really core of our company. So our mission is to overcome healthcare disparity and provide the best medical care to everyone. And to do that, our vision a leading XR medical education and cross-border patient care provider based on alliance of global leading hospitals. So we have medical experts and nursing experts, we have business experts, and we have global experts around the world, and also prestigious advisors. So we think that we can make this happen and we can really impact the world. So our business focus is really two: XR-based medical content and education creation and provision. And also the other side is cross-border medical case consultation. And to do this in a global level, we facilitate establishing a global leading Sky team, which is Smart Hospital Alliance, which I introduced at the very early on of today's conference. So let's look at our first business unit, the XR-based medical content education service. So currently, we are building a XR library with the element function, which will be the platform which can embrace whatever the medical and nursing contents in various forms. For example, we're going to start with 2D videos and 360 videos and some 3D interactive content to begin with. But later on, we're going to build a cloud-based solution to deploy VR and training contents and use remote rendering system, so that wherever you are, what kind of content you have, we will going to make it happen and you can access from anywhere. In parallel, while building this platform, we're also building content as well. Can you click on the videos? So you may have seen a lot of 6 videos here and there, but what's different is that we do not just film the 360 content. As you can see, we have multiple screens. It's not just from the view of doctors, but also nurses and other healthcare professionals as well. And you see the subtitle like there here. So we do not just film the film, but we, with our experts, we actually edit the videos to tailor to students or nurses or even the medical doctors as well. So, and these are all the the surgical videos and PCI videos from the experts from the globe. Okay, let me move on. And at the same time, we also want to standardize nursing education as well. So to begin with, we are creating 2D videos and quiz so that we can really standardize nursing care for everyone. And we are doing this not just shooting a 2D film, we're going to use AR avatars, and we are actually collaborating virtually, which you have seen earlier on, because we do not want to just make a Korean version. We want to take this to the global level. So we want to use these AR avatars so we can create English versions and Russian versions and all other languages as well. And next, with the help of Assam Medical Center, which is one of the members of Smart Hospital Alliance, we're also creating an interactive smart training content as well, which we will gonna have them in our platform later of the end of this year. The next part is cross-border medical consultation service. So you haven't seen a lot of telemedicine companies, but we have structured a little bit differently because we do not want to just talk about common cold or just giving medication for hypertension. We want to serve patients who has complex cases. So we have structured in a way that doctors in the leading hospital consult to doctor in emerging country about the very complex case in patient in emerging country, so that we really provide a valuable second opinion to the doctors, and the doctors can really explain to the patient in the emerging country so they get the best understanding and the best care possible. And we want to do this in a very immersive environment. So we're actually working with Grid, which has a mowing platform. So we want to provide, we are creating a consultation room with cloud-based and real-time 3D XR VOP chatting possible. And as you can see in the screen, we want to share all the medical data in the space so patients have better understanding. In line with this, we're also working with Grid to create a conference platform that's customized and tailored to medical society so we can effectively communicate to each other as well. So we just have started and there's a long way to go, but we aim to build a virtual hospital where we can remote diagnosis, we can do procedures and surgery and embrace digital therapy, and at the same time, doctors managing a chronic disease. And at the same time, we want to create an ecosystem where we can provide medical education and training and also clinical trial. So we really aim to be the center of metaverse in healthcare. Lastly, I really want to thank you all for coming today, and especially our medical institution and society partners and business technical partners as well to make this event happen. Thank you very much.
Thank you, Wonjae. Appreciate it. So, ladies and gentlemen, welcome once again to the 2022 International Healthcare Metaverse Conference. It was very nice to see you all. I think we spent the last 4 hours or so interacting, and I guess the professionals here in the room would have learned from the other tech professionals, and the tech professionals would have gotten a view of what the medical people and the medical industry wants from them. So I think this is kind of an interactive scenario, which we have been trying to create from last year. We started in Manchester. We moved to a next level this year, and I'm sure the next conference, which will take us to an even more improved level, by the time I'm pretty sure that the metaverse would have grown into a much bigger space than I am talking as we are right now. I think one of the companies said they can make a digital avatar of me in 5 days, and then Mike, if you can dress me up very well so that I can get to the beach and avoid paying tax for a while, it'll be a great escape from this universe into the metaverse. Yeah, okay. And last but not the least, I thank for all the companies for participating in this, and I thank all the experts for sparing their time and effort into putting so much into making this a grand success. So I'm going to leave you with a quote here by innovative thinker: "We can see the past, but we cannot influence it. But we can influence the future, but we cannot see it." So let us be guided by all the things we learned today, and hope this conference will make us influence the future. Thank you very much. Have a good day and a great year ahead. On this? I got notes here.